start the session of
Yes.
your doctor. Thank you.
Thank you, sir. Okay, good morning, everyone. Good morning, everyone.
Good morning, Vinit.
Good morning,
Good morning,
sir.
sir. Okay, now, till yesterday, a lot of topics were covered. And these topics were pertaining to, quantitative studies like descriptive studies, case control cohort, experimental studies, some part of statistics and all those things. What we are going to discuss now in this session will be different from these quantitative studies. So we are going to discuss on qualitative research, a research in which we generally look for quality of something. So in this, understand this topic because this topic doesn't contain any form of quantitative data, or this type of research doesn't require any form of statistics as per se. It is mostly qualitative. We are talking mostly about qualitative research. So I want complete interaction from all the participants when we are going through this particular topic. So let's start with this. Now, I want everybody to give their opinion regarding Amitabh Bachchan, considered as a superstar of the millennium. What makes him a superstar? Can anybody reply to me?
The number of super hit films he has given.
Okay, perfect. Anything else?
His unique style and his voice.
Okay, perfect. Unique style and voice. Anything else?
His hard work.
His hard work. Anything else? Yeah? I didn't get it. His fan followings. Okay, fine. Anything else?
Acting skills.
Acting skills. Something more?
His height.
His height, good. Anything else? Anything else?
His style and aura.
His style and aura. Anything else?
His ability to connect with the audience.
Perfect. Anything else?
Dressing sense.
Dressing sense. Good. Anything else? So whatever point you told me till now, everybody, we generally talked about his quality. Fair enough? So his aura, his talking style, his personality, his connecting with the audience, all these things are qualitative. They contain some quality about him. So when we do a qualitative research, we look for some qualities. So I asked opinion. You cannot measure anybody's opinion in a graduated scale, right? There is no scale or no, you cannot say I have 5 grams of opinion. I have 10 kgs of opinion, or my opinion is 100 centimeter. No, opinion, perception, belief, attitude, all these things are qualitative in nature. They do not contain any measurement, or they do not have a unit, or that cannot be measured in a graduated scale like any other quantitative data. So if we are talking about height of an individual, we are talking about in feet, something in feet, 5 feet or 6 feet. But opinion, understanding, attitude, belief, perception, all this cannot be quantified. We cannot weigh them. We cannot assess them in a millimeter or a meter or kg or kilogram or liters, or We cannot do that. So that type of study design is called as qualitative research. So I am Dr. Vinit Vinay, and I'll be talking about qualitative research. So if you want to explore the perception and experience of healthcare clinicians in multidisciplinary team that include specialist heart failure nurses when caring for a management of heart failure patients. So we want to look for perception and experience. You cannot quantify experience and perception, right? So the result will be communication with patient, and communication within the team is very important thing. So that was the result. So there is no percentage, there is no number in it, right? It comes in this way. The result comes in this way. Another example, I am planning to do a qualitative study on the role of patient-nurse communication in acute cardiac care. So the result was trust. Trust is important. And nurses' presence and availability, not only in the emergency phase, but throughout the hospitalization. So that is a qualitative study we have done. Okay. So qualitative research covers an array of multiple interpretative techniques and practices which aim to show an insight or judgment on how human beings understand, experience, and interpret the social world. That is important. How they understand, what is their experience, and how they interpret the social world. That is qualitative research. Okay. It's basically depend on watching people in their setting and interacting with them under their condition. So there are various synonyms of qualitative research. It can also be called as interpretative research or naturalistic research or phenomenological research, descriptive research or participatory research. These are the different names of qualitative research. Wherever you see these names, believe me, it's a qualitative research. So how does qualitative research differ from quantitative research? So qualitative research is to explore, interpret, and obtain deeper understanding of a social phenomenon. Qualitative research is about the people, why and how. In qualitative research, we generally go with non-probability sampling. Data will be very vast and time-consuming in qualitative research. But design emerges as the study unfolds. You don't have to plan everything in a qualitative research. When you start doing the study, the design itself will keep changing. It will emerge. New designs will come when you do the study completely. And researcher is the instrument in this qualitative research. If you are doing a qualitative research, you are the instrument. You need not do any kind of, you need not take any kind of equipment or instrument to do qualitative research. You don't have to take a mouth mirror or a probe. You don't have to take a BP apparatus. Nothing. It's you. You are the instrument. The way you connect with the people, the way you make rapport with the people, that is important. And then you are the researcher. You are the instrument. You, the researcher, are the instrument of a qualitative research. And in qualitative research, we formulate hypotheses and it reports the natural experience. Whereas in quantitative research, it generates statistics, right? Everybody knows about it. We have done statistics 2 days back, 1 or 2 days in these last 2 days. And it is focused on research question and how many, when, and where is the question in this. Mostly probability sampling is done in quantitative research. Data is very precise. Design is decided in advance. You have to make a proper protocol in the beginning itself for quantitative research. And you can use various tools, instruments or questionnaire for a quantitative research. And basically quantitative research is done to test hypothesis, and quantitative research focuses on cause and effect. So these are the difference of qualitative and quantitative research. So in quantitative research, you have a structured data, statistical analysis with their conclusion will be very objective. And for an example, when you do survey or an experiment. But in qualitative research, data is unstructured. There is no statistics, but there is a result in summary. Conclusion will be very subjective. What you feel is a conclusion. It's not necessarily everybody will feel the same. And you can do interviews, focus group discussions, and observation in a qualitative research. So quantitative research is objective, qualitative is subjective, Quantitative research is deductive, it is inductive. Quantitative research is generalizable. You can generalize when you do a quantitative research, but qualitative you cannot generalize. It is not generalizable. And in quantitative research, the results are in numbers, 10%, 20%, 10 millimeter, 20 millimeter, something like that. But in qualitative research, the results are in words. So these are some pictures of a qualitative research. So there are various traditions, there are different methods of qualitative research, different types of qualitative research. So the first one is ethnography, the second one is grounded theory, phenomenology, clinical research, and case study. Now, clinical research here is not a quantitative clinical research. It's a qualitative clinical research. I will tell you what it is exactly. So when we are talking about ethnography, ethno means people. Ethnography means portrait of a people, So when we want to do a study in which we want to understand the culture and people, we will do a ethnography. Okay, so underlining culture of the defined groups can be we can do, and we can people under investigation have something in common. For example, religious or geographical or social, familial, or any shared experience or shared belief and practice. On them we can do ethnography type of qualitative research. Okay, so for this you can take formal or informal interviews. Then there is another type where it is called as grounded theory. So what happens in this? There is some theory which is there within that particular phenomenon, and you want to develop that new theory that is called as grounded theory. So it aims to develop theory which has emerged from the data using constant comparative methods. So this new theory can be applied, enabling us to approach existing problem in a new way. Something we want to do, something for a solution, some solution for a problem in a different kind of a way. Then third type is phenomenology. Phenomenology means live experience of a phenomenon. So for an example, if there is an earthquake or some natural things happening in the world. For example, let's take COVID also. People are suffering with COVID. So live experience of a phenomenon under study is called as phenomenology. We want to small number of study participants you have to take, and participants, what is their perspective? That you can understand when you are doing a phenomenology study. Clinical research is a qualitative study done under clinical setting. So for an example, there is a HIV clinic or HIV hospital. Okay, so there are patients sitting in that HIV hospital. And you can go there in that clinical setting and you can do a qualitative research. For an example, you can ask patients what is their opinion about their social life. They are HIV positive and how they react to the social life. What is their experience, personal experience and social experience. Like that we can do in a clinical setting, that is called as clinical research. And the last one is case study. Case study is done for a single person, like case report. Case report when we do it for a single individual, right? Similarly, case study in qualitative study, we do for a single patient over a period of time. We will follow the patient from one time to the other time, and we'll find out what are the changes. We see his adjustment, how he reacts to the society, how he reacts to his family. All those things can be done in this. That is a case study. Am I clear, everybody? Anybody has any doubt?
No, Vinit.
Anybody has any doubt, yes or no?
Go ahead, Vinit.
Okay, sir. So there is a sequence of qualitative research. First, you need to observe the event, what is happening. You can ask questions, which is an open-ended answers. Okay. Second, you have to record whatever the patient says. You have to record in a paper or a notebook. What he said or what he does also. While saying somebody might scratch his head. That also you have to write. Each and everything, whatever he says, whatever he does, everything you have to write it down, record it. And then you interpret the personal reactions, write speculations, and monitor the methods. Then again observe and ask more questions. Repeat the cycles to reconfirm. Then you will make a theory. Then you will formal theorization will be there. And then you have to draw the conclusion. This is the result. Sampling. Sampling method in a qualitative research is simple. It is a purposive sampling. So the type of people you want, what is the pre-selected criteria? On the basis of that, you have to select the people. So for an example, I am doing a qualitative study on second trimester pregnant women of 19 to, let's say, 30 years. 20 to 30 years, pregnant women. And I want to see their, this personal experience. So I will select only those patients who are in second trimester, 20 to 30 year pregnancy. So that becomes a purposive sampling. Then there is another type called a snowball sampling. So snowball sampling in which I select one participant and I will ask him if you know somebody else of your own characteristic. So he'll give me two more participants. From these two more, again, I'll ask one each. So two more each fellow. So this is called as snowball sampling. So if I want to do a study on, let's say, drug peddlers or sex workers, then I will go with snowball sampling. The third type is saturation. Now this is important because when I ask you, why do you like, what is your opinion regarding, Amitabh Bachchan to be a superstar? So you gave me 1, 2, 3, 4, 5, 6 points, or let's say 10 points. You have not given me anything more than that. So my study will end there itself on 10 participants only. If I'm not getting new results, so that is my sample size. How much ever I got is my sample size. If I'm not getting new results or new themes, so that is a point where I'll stop my study. So that is called as saturation. You are saturated with the results. You are saturated with the theme. And that is called saturation sampling. So there are different methods of qualitative research. One, the most important is focus group discussion and in-depth interview. Other are observation methods, social mapping, timelines, and transect walk. I'll tell you a little about all these methods. Focus group discussion means there is a small number of participants, subjects, let's say 8 to 12 participants. You will ask them to, everybody to sit together, and then you will keep asking them questions. And you will note down who says what. And you will be chairing the session, and you will tape record, audio recording will be done for the whole process. And you will write exactly what the participants say. That is called transcript. And then you will analyze it. So that is called as focus group discussion. So this is a focus group discussion going on. And she is the researcher. She is chairing the session. Next step is observation. Observation means you just have to observe what people are doing, nothing else. So you can either become an external observation or participant observation. External means there are a lot of people doing discussion, and from outside you are observing them. In participant observation means there are a lot of people doing discussion, and you also sit within them, you also participate. That is called as participant observer. So you become a participant and then observe. But in this, you are sitting outside and observing what is happening. So that is called as external observer. So like this, he is observing. Key informant interview means instead of taking so many participants, I will take somebody who is who has a special knowledge status, So if I want to do a qualitative research in a village, instead of taking so many participants, I will take the village panchayat, only one person. So he'll be the key informant. So that is one method of collecting data in qualitative research. Social mapping. Social mapping is a method in which a map is created by the villagers for researchers to understand the community layout. So their infrastructure, their demographic, any ethno-linguistic group and all, distribution, access and use of resource. So they will draw a map like this. So they are drawing a map on a floor and explaining about their village, about their community. And after this, I will go home and draw it in a fair paper in a proper way. So that type is called as social mapping. So the village will tell, the lady is telling me what all things are available in the village and everything, how it looks like, what is the infrastructure and all those things. So that type is called as social mapping. Timeline. Timeline is a method in which you, over the time, what changes or what event have taken place over the time. You have to draw that, you have to discuss that, you have to write that. That is called as timelines. So let's talk about 2019 December until now, till today. If you are doing a study in China regarding COVID, you are following the people's experience, you are drawing the diagram, graphical technique is being used. Or what changes have taken place since then. So that is called as timelines. So there are different forms of data. I told you when you do a qualitative research, go with a field data, field notes first, you write everything, whatever you can. You can audio record or sometimes video record also, that is important. And recordings and transcripts are different forms of data, what you are getting from the participants. So for this example, there was a lady called as Janet Selle in Zambia in 1987. She did a qualitative research. Her postdoctoral research was this. She made a raw notes. She made raw notes. And then when she went home or when she went to her place, she made a transcript into a duplicate notebook like this. So this is what she scribbled. And then when she went to her room, she wrote like this. So this is how you have to do. When you are doing a qualitative research, write a note and then go back home or go to your place and make a fair copy of it. Properly, you have to write it down. What are the aspects to be covered when you are writing the notes? When you are doing a qualitative research and when you are writing the notes, you have to write about the setting. In what setting you are writing, doing this experiment or doing this research. So you record the complete physical environment and good visual experience. So you have to, participants' appearance has to be noted down, participants' behavior, participants' verbal and physical interaction also you have to write it down. What activity is going on, where is it going on, who is involved, who else is present, how long it happened, and how do people behave. Everything you have to write it down in a note, whatever is happening. Okay. For every patient, for every participant, not patient, participants, you have to write it down. That is important when you are doing a field note. Recording device. Use a recording device, audio device or video or whatever, it's up to you. Better use at least audio recording because sometimes while writing notes in the field, you might miss some words or something you miss. But you have audio recorded, when you go back home, you can correlate and write the missing word or missing sentence, whatever you have done. Capture the exact word. That is called as transcript verbatim. In a qualitative research, it is very important to write whatever the participant have told. And digital recorded data can be coded while still in digital format. You have to code them, bring it back. Can put sometimes, when you do recording, some people might, they say, no, please don't do recording and all those things. You have to accept that and do the field notes alone. So let's give me an example. I'll give you an example. Now, I was doing a qualitative research. The patient's name was, the key informant was Shah Rukh Khan. The patient's name was Shah Rukh Khan. Location of the interview was at home, Mumbai. This is how you have to write it down. And the date of interview was 30th February 2018. Length of the interview was 45 minutes, conducted by Vinit Vinay. The type of interview was in-depth, and the context of interview was, this was the first interview we conducted in Shah Rukh's home. My patient name is Shah Rukh Khan. Process. Shah Rukh welcomed us warmly. He seemed very comfortable. 2 of his children were present. That time he had only 2 children. So I did that. At one point, Gauri entered. My patient, Shah Rukh Khan's wife name was also Gauri. And the content was, during this interview, Shah Rukh told us that nowadays their pictures, their movies are not running. There are new actors coming in the market. OTT has killed the movies and all those things. So this is how you record. Write it down. Everything whenever you do a qualitative research. Coming to stages in analyzing, you have recorded everything, whatever you have to record in a qualitative research, now you have to analyze. So when you write everything, there will be many pages of text. Whatever people will say, you keep writing it down. From that text, you will make some segments of text. From pages, you will take out some segments, which are important. From that segments, you will make some 30 to 40 codes. From that codes, you will reduce them to 20 codes, and from that 20 codes, you will develop 5 to 7 themes. So that is the whole stage of analysis. There is no statistics. Everything has to be done manually. You have to read all the text from different pages. From pages, you have to take some paragraphs, some segments which are important. From there, you will take 30 to 40 codes. 30 to 40 codes will go to 20 codes. And from 20 codes, you will make 5 or 7 themes. So what are themes? Themes are broad categories of information. Themes can describe a setting and themes can describe what occurred. In 5 to 7 themes, some have to be what you would expect, and some things which you do not expect can also come out. These themes can be related to chronology or grounded theory model. Ethics and logistic of data collection. Ethical consideration is same as that of a quantitative research. Okay, you have to take consent, you have to make a study proposal, all those things, same thing has to be done, like the way you do in quantitative research. You have to inform the patient about the purpose, procedure, risk, benefit, confidentiality, voluntary participation, refusal and withdrawal, and written and verbal consent has to be taken. You have to consider trust also, honesty, reciprocity, and advocacy and intervention. This is important because I told you, you are the instrument in a qualitative research. If you are honest, if you are having a good rapport with the population, you can very well do a good qualitative research. And you have to be very careful with the vulnerable population like children, women, independent relationship, or ethnic group, or marginalized group of men and women. Okay, you cannot do a qualitative research without their consent. It is very important to take consent. Coming to strength of qualitative research gives you depth and detail. It is done in depth and detail, more than a questionnaire. Because in questionnaire study, you have given them options. They can mark only in those options, or even if it is open-ended. But the questions are decided in the beginning itself. In a qualitative research, you can change the question as the design unfolds, as the study unfolds. There is openness. People can say whatever they want to. You will see people are telling everything, whatever they feel like telling. Active participation is more in a qualitative research and it avoids prejudgments. That is the strength of a qualitative research. Weakness, only few people can be studied. You have to take only usually few people as studies. You cannot generalize the results because opinion of one group of people will be different from the other. So you cannot generalize the results, whatever you get. The data is difficult to aggregate and depends on researchers' attribute and skills. So if I am doing a research on a pregnant woman of second trimester, probably I will not be very successful in it. But a female investigator does. Same thing, same procedure. Probably she is going to get a better result or proper result. So it depends on the researcher's attributes and skills also. And the response of the participant changes in social situation. So if you are taking an interview in one closed room or quiet room, you will get a good response. But same study if you do in public, in front of a lot of people, then your response will be different. So that is the weakness of a qualitative research. So when can you do a qualitative research? You can do it before quantitative research, after quantitative research, and both before and after also you can do. That is called as mixed model research approach, mixed model approach, where you are doing qualitative research also as well as quantitative research. There are various softwares for analyzing of qualitative data. All these are the softwares where you can analyze. There is no statistics, but they will help you developing theme using this software. And the best one is NVivo. Why is it the best one? Because I know to use NVivo. I don't know other things. So that is NVivo is the best one. How do we validate our qualitative data? So ways in which data is collected and analyzed are distorted by the researcher's theory, values, and preconception. That is called as research bias. If you are having any preconception or your theory already, so there will be a bias in the qualitative data. So the validity will not be there. And reactivity means the effect of research on the research setting. How the research affects the research setting, that is called as reactivity. So both of them can lead to validity threats. So your result, your qualitative research will be not valid. Respondent validation is also important. You have to systematically solicit feedback about the data and the conclusion from study population. Keep taking feedbacks from the participants. It will rule out possible misinterpretation, and it will help in identify the bias, interviewer's bias and misunderstanding. So you have to validate by asking your response, asking questions repeatedly in different format, so that your study becomes validated. There is something called triangulation. I'll tell you what is a triangulation. Now I told you I'm doing a focus group discussion on one group of people, and I'm getting this result. This is my result, R. Now, how do I confirm whether the result I got is correct? So I will do an in-depth interview also. And if I get the same results, it means I have triangulated. Then my study is good. It has a validity. It has a good validity. That is called as triangulation. Another example, I am doing a research and I got this result. Vinit Vinay has done a research. Now another observer of another teammate of mine also does a research. And he also got the same result. Then this is called as triangulation. So that is how you do. When you do a research, qualitative research, go for triangulation. So triangulation from different sources can be done, triangulation from different methods can be done, and triangulation from different researchers can be done. Different multiple method triangulation, multiple researcher, multiple theories, and multiple data set. So there are various guidelines. For an example, if you are doing an RCT, you have a consort guidelines. When you are doing an observational study, you have a strobe guideline. Similarly, for qualitative research, you have a Cohort guideline. Follow this guideline whenever you are doing a qualitative research. There are 32 item checklist and can be used for interviews and focus group discussion only. However, there are other guidelines also, SRQR, RATS, and CAPS. So to conclude, qualitative research methods have a long history in social sciences and deserve to be an essential component in health and health services research. Qualitative interview is flexible and powerful tool. Nowadays, people are doing a lot of qualitative research because a lot of quantitative research has been done. So people now want to do something for the social population or for social research they are going for. And as a clinician also, you can do qualitative research to investigate research question of immediate relevance to their everyday work, which would otherwise be difficult to investigate. This will enable you clinicians. So I enjoy loving qualitative research. Thank you so much. Do you have any questions? You can ask me right away. Or you can contact me. This is me. This is my website. This is my YouTube channel, my phone number, and my email address. You can ask me anytime if you want to. Thank you so much. Do you have any doubt?
I need a clarification.
Yes, ma'am.
If you're doing the qualitative research for the first time, then do you think we should do the coding manually or we should use softwares?
Manually, ma'am. Manually is the best method. Software, when we have a lot of work to do, a lot of coding to be done, a lot of themes come out, better to use software. But if you're doing it the first time, you should do it manually.
Thank you.
Thank you, ma'am. Anybody has any more question, or should I move to the next topic?
Move on, move on. Everybody is fully aware.
Okay, sir. Thank you, sir. Okay, let's start with the next topic. This is again an interesting topic. It's called as questionnaire designing, how to design a questionnaire. So nowadays, a lot of questionnaire studies are coming up. Every now and then we keep getting some Google Forms or any kind of other internet online forms in which we are doing questionnaire designing, questionnaire research. And during this COVID times, I think everybody has done a questionnaire study or involved in a questionnaire study, mostly. And believe me, out of 100 questionnaire studies, what we do, only 2% of the questionnaire studies are valid and reliable. Only 2%. So in 100, only 2 questionnaire studies are actually good. 98% of the studies are not good at all because most of them have not done their validity, reliability of the questionnaire. They have not designed the questionnaire properly. The response are, let's be blunt, it's fake. Many people fake the results. Even participants are not very keen in doing questionnaire studies. The questionnaire is, they're not keen in responding to questionnaire results. So they just respond whatever they feel like doing. So it's not properly done. 98% of time, only 2% time they have validated and reliable questionnaire studies they have done. However, it's very easy to do a questionnaire study At the same time, if you really want to do it properly, then it's not so easy to do a questionnaire study. And validating and doing a reliability of a questionnaire study is a very essential part. You have to go with the validity and reliability of that particular questionnaire study. So before validity and reliability, it's important for you to understand what type of questions you have to put, what type of response, what type of options you have to give it to them. So that is what this topic is about, designing a questionnaire for designing a questionnaire or doing a questionnaire designing or questionnaire study or something like that. So it's very important for you to understand the question, what you are going to ask. The question should be very specific. It should be, would you like to have a coffee sometime? The important thing is with me. So now the question is complete. Would you like to have a coffee sometime with me? So that is the exact question which you want to put up. So in this questionnaire session, in this designing a questionnaire protocol session, I'm going to talk to you about what are the different types of questions, how to design a questionnaire, how to do validity and reliability of a questionnaire, and what not to do when you're doing a questionnaire, when you're developing a questionnaire. So just like a mouth mirror or a probe or a CBCT or a RVG or X-rays or different types of method, questionnaire also is a research instrument which has a series of questions and prompts. This is a purpose of gathering information. So if I want to find out the age of a participant, how am I going to do that? Can anybody respond? Any participant? Can you respond? If I want to find the age of a participant, what can I do? Anybody? Am I audible?
Yeah, you are audible.
Okay, sir. Any delegate who can tell me how to find out the age of a participant?
If the participant is or they are children, you can ask in what standard they study.
So you will ask. If the participant is more than 18 years or 20 years, then?
Aadhaar card check karna nahi.
If you give
अगर
them
पेशेंट के
coded
पास
forms,
आधार कार्ड नहीं है तो?
So if you give them coded forms,
Yes. So it means you are going to ask, right?
the form is coded.
Yes, in a
They'll be
written
just,
format.
yeah.
So there are certain questions which you cannot measure using an instrument. You can just ask. How many cigarettes do you smoke in a day? How can you find out that information? If I want to know somebody's smoking habit, how can I do this?
You have to ask the person.
So you can just ask, right?
Yes.
That is why your questionnaire becomes an instrument. There are certain information which you cannot get by clinical examination or by X-ray or by whatever method of equipment. You have to just ask, and asking that in a form of a questionnaire, question, and questions are the content of a questionnaire. So that is why questionnaire study is a part of every study. Whatever clinical research, or if you do randomized controlled trial, you are going to ask patient's name, age, gender, demographic, socioeconomic status, occupation, education. So questionnaire will be there in all kind of study designs. Of course, when you're doing in vitro studies, you will not ask all these things, lab studies and all. But if you're doing a study for patients or clinical research or clinical study, you are going to get this information only through a questionnaire. So there are questions, there are things which information about that only we can get by asking questions. So what do you mean by a questionnaire? It is a method in which it is a measurement of instrument for assessing individual attitudes beliefs, behavior, or attributes beside clinical research. It is a measurement instrument for assessing individuals' attitude, beliefs, behavior, or attribute besides clinical research given by Bauman and Fisher in 1987. What are the advantages of using a questionnaire? Impersonality, response anonymity. It can cover to a larger population. It is relatively economical and it requires less time. That is the advantage of a questionnaire. So before you decide to use a questionnaire, you have to understand whether this questionnaire is an optimal method or not. Now, if you are doing a study on implants and you are following patient for 6 months, and when the patient comes, you cannot ask him what is your bone height. Can you do that? Can you ask the patient after placing implant, 6 months after placing implant, can you ask the patient what is your bone height?
No.
So the questionnaire will not be an optimal method there, right? You have to take an X-ray and then find out what is the bone height, or you have to take a CBCT and find out. So you have to understand, you cannot apply questionnaire everywhere also. What specific characteristics are you interested in studying? Also, you have to decide, then only you decide whether you can use a questionnaire. You have to understand the patients or the participants or the respondents' literacy level and comprehension level. So you cannot give a Marathi questionnaire to a Spanish population. And you cannot give a questionnaire in which there are some technical jargons written like MTP. Everybody knows what is MTP? Everybody knows? MTP is medical termination of pregnancy. In your questionnaire, if you write MTP, they are not going to understand. So you have to write the word abortion there. So you have to understand the comprehension level of the respondent. And you have to be very careful about social, cultural, and religious issues, whether you can address it or not, before you decide to use a questionnaire. What are the options? Now, there are 3 options. Whether you use a questionnaire which is already done, already somebody has done a study and using a questionnaire, you can use the same questionnaire. Or you can modify that questionnaire according to your requirement. Or you can design a whole new questionnaire. So you have first option, second option, and third option. If you are using an existing questionnaire, you don't have to validate because it's already pre-validated. But if you are modifying that questionnaire, you have to validate that questionnaire. And of course, if you're making a new questionnaire completely, then definitely you have to go for validation. So these are the 3 options you will have for a questionnaire study. Rules for designing a questionnaire. Number of variables you want to include and measure. You have to understand this first. How many numbers of questions or variables you are going to use. What is the assessment of the variable? The language has to be very clear and unambiguous. Questions must be short, simple, and clear. And the method of processing the data can also influence the design. So again, when you are doing a questionnaire study and you are giving a statistician to do a statistics for it, he will ask you in codes. He will not ask you the response and all. He will ask you the response in codes. So you have to understand whether you can do coding for those responses or not. That is important. Don't make your response or the questionnaire very difficult. Now, there are various steps in questionnaire construction. First, you should have a research question or a hypothesis. After having that, you have to decide whether questionnaire is the best method or not. Then, what type of questionnaire is needed for the purpose? There are various types of questionnaire. What type is needed for the purpose? That you have to decide. Then you have to prepare the content area. Content area is nothing but the question, the heading of a questionnaire, the subheadings of the questionnaire, different questionnaires under questions under it. All this is called as the content area. Then you have to prepare the content area. Then you formulate the questions, place the questions in order, format the questionnaire, pilot test the questionnaire, and then check for validity and reliability. So these are the steps in questionnaire construction. So you have to follow, in case you are doing a study, making a new questionnaire, you have to follow this particular steps, these particular steps. Coming to types of questionnaire. The questionnaire can be structured, unstructured, adaptive. A structured means asking all the participants the same question in the same way, in the same order. Unstructured means every question depends on the answer given by the previous question. Adaptive means a series of questions are prepared and only a subset of questions are asked. Did everybody understand these three types of a questionnaire? Structured, unstructured, and adaptive? If you have any doubt, you can ask me right away. Or do you want me to give some examples?
Yes, please, some examples.
Okay, ma'am. So structured questionnaire, let's start with the first one. Now, I have certain questions. For an example, first questionnaire, my questionnaire first, I'm going to ask about dietary habit. I have certain questions in this. There are 4 questions. Second set of questions are on smoking habit. I have some 5-6 questions in this. Third, I'm talking about personal habits. So this is a structured one. Same type of questions I'm going to ask all the participants. Okay. Unstructured means I'm going to ask him some questions. Do you smoke? There is no heading, no subheading, nothing like that. If yes, go to question number 4. If no, go to question number 2. Unstructured. There is no heading here like this in a structured format. Adaptive means from the first itself, are you a current smoker? If yes, answer questions number 1 to 10. If you are not a current smoker or a previous smoker, go to question number 11 to 20. Am I clear?
Yes.
Thank you, ma'am. So these are the three types of questionnaire: structured, unstructured, adaptive. There are various types of questions. Whenever you start, the question has to follow logically. It should start with a, where you can get the best response rates, and then gradually come to more sensitive or, questions, like coming to the more specific questions. So there are different types of questions like screens, warm-ups, transitions, skips, difficult, and classification. Screen means your first question will decide whether you have to complete the questionnaire or not. So let's say, did you ever get COVID-19 infection? If yes, then follow then do all the questionnaires. If no, then quit the questionnaire, quit it. So that is called as screens. Warm-up means simple to answer questionnaires in the beginning. Generally for kids, we do this. So we'll ask a kid, what is your name? What is your age? What is your favorite cricketer? What is your favorite sports? Do you like painting? This will just warm them up. And then later you can ask some serious or specific questions. Transition questions means different areas flow well together. Your questionnaire should have a transition. So if you have a question like, first we have a question on smoking habits. So first you will ask, do you smoke? If yes, how many cigarettes per day? Since when did you start smoking? You cannot ask the first question, do you want to quit smoking? No, first you ask the flow should be such like that you are asking from the beginning, do you smoke, how many cigarettes, and that is called as transition questions. Skip means if yes, then answer 3. If no, then continue to question 5, something like that. Difficult questions means those questions where response is difficult to get, or the important one, the specific ones. Generally keep those type of questions towards the end. And classification question means demographic questions. You can put them, generally should be at the end, because you are going to ask them some personal details. Ideally, demographic questions should be in the end. Coming to type of questions, start with a general questions, go to specific, and then go down to really specific. So the types of questions are open format and closed format, and structured and unstructured again. I told you about structured and unstructured format. What is an open format and what is a closed format? I'm going to tell you. Open format, which is free to answer, there is no options given. But in closed format, there are options. You have to tick one or multiple, or depending on that. So it can be a multiple choice question in a closed format, or yes, no type. So let's go to open-ended question. So what is the example of an open-ended question? What happened when you met your dentist for the first time? And then you give them options, space to write. No options, only space to write whatever they feel like writing. That is called as open-ended question. No responses, no options are provided, and complete freedom to the respondent. So they have an advantage and disadvantage. It is free to answer and a chance to vivid expression, but disadvantage is read and think individually. Tabulation is not automatically done, influential on the reader, and boring to the interview. Close-ended questions. How do you feel waiting for your dentist call for extraction of your tooth outside in a common waiting room? And you have given them 1, 2, 3, 4 options. So that is called as close-ended questions. If a dog wore pants, would he wear them like this or like this? So you have given them options. That is called as close-ended questions. So close-ended questions again cannot be of two types, ordered choice or unordered choice. So how important were the following people in helping you to decide on nursing as a profession? So a relative, nurse, and friend, and you have given them orders. So I will tell my nurse, relative, not important, nurse, very important, my friend, really important, relatively important. Then close-ended, unordered is who is the most important person in helping you to decide a nursing as a profession to your nurse. Partially close-ended means you have an option and you have also given a space for other where you can write whatever they want to write. So it's partially close-ended. So they have advantage and disadvantage, easy to answer, quick and not boring, easy to compute results, but disadvantage is not much involvement, hardly any thinking, and no place for expression. Am I clear, everybody? Am I clear, everybody?
Yes, sir.
Yes.
Am I crystal clear?
Yes, sir.
You have any doubt, you can ask me right away.
So how do we analyze these open-ended questions?
Yes, open-ended questions, again, we have to make a coding for them when you have open-ended questions, or you can give a response, whatever they respond, you can make an Alexa section of open-ended questions, and you just tell them what they have responded. That's all. No statistics is required for open-ended questions. Am I clear, ma'am?
Yes. Thank you.
Thank you. So it's always good to have a close-ended question. If you know what the responses can be, so better make a close-ended questionnaire. But if you want something new, if you're doing something new and you don't know what the responses can be, then go with the open format. Pre-coded single choice questionnaire means, you have already pre-coded them 1, 2, 3, 4. In the questionnaire itself, you have coded them. So that is called as pre-coded single choice question. Presence and absence question. Have you ever had contact with a physically handicapped person in any of these groups? They have to mark yes, no, yes, yes, no, no. Or circle. So I'll circle here. Rank ordering questions. Rank ordering questions mean ask respondent to indicate an ordering of response item, usually from most preferred to least preferred. So you can rank here. Rank order the 3 most important characteristics you want in the job you make your life's work. So this was a question given to me. So I can code. First, I want, prestige, excitement, high salary. I've coded them. Actually, for me, 1, 2, 3 is high salary only. Everything is high salary. So this is called rank ordering questions. You can mark them, rank them according to your choice. Now, what are the types of questionnaire? Questionnaire. Till now, we're talking about questions. Now I'm talking about the type of questionnaire. So the questionnaire can be funnel pattern. What is funnel pattern? First few questions are open-ended. And then later, the questions are close-ended. That is called as funnel pattern. We make a funnel. Reverse funnel means few questions are close-ended in the beginning and later the questions are open-ended. Funnel. Inverse funnel pattern. And tunnel pattern means all the question in the form of a tunnel. All the questions are either close-ended or open-ended. Tunnel. So it creates monotony, Same type of questionnaires all through. So it can be either open-ended or closed-ended. The content, preparing the content area. I told you you have to prepare a content area. From where do we prepare the content area? What question to ask? What should be the subheading? What should be the heading? All this you can do by literature search, by expert advice, by brainstorming. by focus group discussion or by interview or talking to your experts, like that you can find out what question has to be asked. Formulating the questions. You have to formulate the questions now. Now identify the content area. You have identified which are relevant. So for an example, a survey to measure the usefulness of new material in dental treatment can have the following domains. You have to select the domains. The first will be ease of use, safety aspect, cost, cultural acceptability and availability. For under every domain, you will ask questions. For example, safety aspect, very safe, moderately safe, safe or unsafe. Then cost, less cost, high cost, medium cost, whatever. Selecting the items. Items, I'm talking about questions. Each and individual questions are called as items here. So you have to understand the reading ability of the respondent, ambiguity of the items, personal and cultural reinterpretation. Your question shouldn't be, somebody personally is taking it otherwise. No. Presence of any double-barreled questions like how is the taste and appearance of a pancake? Now, I can like the taste, but appearance I may not like. So that is a double-barrel questionnaire. Any unfamiliar terms should not be asked in a questionnaire. The respondent should be familiar with all the terms. Whatever we are putting in the questionnaire, he should be familiar with all those terms. Embarrassing, judgmental, and insulting questions should not be there. So you cannot ask a double-barrel question that do you like Deepika or Priyanka? I might like Deepika, I don't like Priyanka. Or I might like Priyanka, I don't like Deepika. So this is called as double-barreled questions. So you should ask first question, do you like Deepika? Yes or no? Do you like Priyanka? Yes or no? So that is better. So because the question which you're asking can be really confusing for the participant, you have to be very careful. From your point of view, you think this is right. From the participant point of view, it may not be. So questions to be avoided, which are ambiguous questions. Is your work made more difficult because you are expecting a baby? Now this can be other way around also. The work has made it difficult because you are expecting baby, or because of you are expecting baby, the work has become difficult, something like that. Don't use vague words. Regularly and occasionally. For me, occasionally is regularly. How often do we exercise? If I exercise once in a month, I am regularly doing once in a month. So that can be a vague word. Leading questions. Don't ask leading questions. Do you do physical exercise like cycling? This is a leading question. And don't ask sensitive questions. How old are you? This might also turn off the spirit of the participant. The criteria for wording the question is simple. It should be simple, unambiguous, clear, and concise. Language translation. Whenever you are doing a questionnaire study, if the questionnaire is already you are using the questionnaire is in English, then you have to translate that question in Marathi for your Marathi population. And the same questionnaire of Marathi population, you have to back translate into English. And you have to compare the first English version and the second English version. If both are simple, then both are similar, then it means your Marathi version is validated or translated properly. Am I getting my point? Yeah, are you getting my point?
Yes.
Yes, sir.
So that is called as translation and back translation. English to Marathi and Marathi to English. When you are making a questionnaire, important to format the questionnaire. You should give the page numbers. Font size should be clear and legible. simple and clearly, must look, read, and simple and clearly. And adequate instruction has to be given. Right on the top, please tick the appropriate response or please circle the appropriate response. Like this. Give them a space to tick or give, if you want to circle, ask them to circle. Or if you want them to draw a cross, let them draw a cross. Give proper instructions. And when you are doing, giving symbols, when you are doing for kids and all, draw the symbols, draw the smileys. And when you are giving an open-ended questionnaire or item question, give them space to write. Don't give them full page. They will start writing everything. Coming to pilot testing of a questionnaire, this is important. Pilot testing and pilot pre-testing and pilot testing is mandatory in a questionnaire study. Remember this. Don't just get up one morning and you say, "Aaj main questionnaire study karunga." No, you cannot do that. You cannot get up in the morning and say, "Today I'm going to do a questionnaire study." It takes time. You have to validate your questionnaire study. You have to do the pre-testing and pilot testing of your questionnaire. That is important. So you have to understand the questionnaire. You have to cognitive review the process. Adequacy of response, you have to consider any regional differences or any filter questions or skip patterns adequate. You have to understand this. This you can understand only by doing a pre-testing or a pilot testing. A well-designed questionnaire should meet the objective of the research. Should meet the objective of the research, obtain the most complete and accurate information. It should do the job in available time and resources and be cross-culturally valid. Now, if you are doing a study on dietary habits, and if you are taking a questionnaire which was already been used in United States, and you are asking what do you take in breakfast? The breakfast, what they take in America is something else. They take, pancakes or burgers or, whatever, hot dogs and all for breakfast. But in India, in Maharashtra, we take idli sambar, or we take bread, or we take pohe, all those things. So that questionnaire you have to convert based on the culture of the place where you are doing the study. So it should be cross-culturally valid. Now there are various methods to administer a questionnaire. The first method is personally, when you are asking a question to a patient, you will get a better response. Or you can also send a questionnaire via mail or via WhatsApp or via all those things, or by a postal mail. Earlier they used to send by postal mail. That you can do. Your questionnaire can be interviewer administered. It means when you are asking a question to the participants and you are taking the response and writing in your questionnaire, that is called as interviewer administered. But if you are giving the questionnaire to the participants and telling them to fill, they will fill the questionnaire. That is called as self-administered. Third one is telephone administered. You might be getting calls from various malls or somewhere. Please press 1 if you like the call or whatever. That is telephone administered or internet administered or online questionnaire, which nowadays is in full boom. Coming to the last part of your questionnaire, that is validity and reliability. Now, what do we mean by validity? Validity means the ability of an instrument or a questionnaire to measure what it is intended to measure. A questionnaire on smoking habits should measure smoking habits of an individual. Okay, so it has to be like that. So if that questionnaire is valid, it means whatever you have intended, the questionnaire will measure. So there are various types of validity: content validity, criterion validity, and construct validity. Remember these three types of validity: content, criterion, and construct. Content validity is nothing. It is also it is the face validity. Face validity means just by looking at the questionnaire, you can say this questionnaire is meant to assess this. That is called as face validity. So that can be done with the help of subject experts in your college, in your vicinity, in your institute. Criterion validity means the criteria of that particular questionnaire, how validity. And construct means the logical flow of that questionnaire, how valid it is, the construct. That is called as construct validity. So content validity is to examine the extent to which the concept of interest are comprehensively represented by the items or by the questions in the questionnaire. So if you're talking about smoking habits, all 5-10 questions what you're putting should be pertaining to smoking habits only. So there are two phases of content validity. The first one is researcher will conceptualize and make a domain analysis and specify the full domain of content that is relevant to the issue, sample specific areas from this domain, and then you put items or question in a form that is testable. Then you will go to the experts, enhancement of content of questionnaire. You will at least have 7 or more experts in your field. It can be your guide, it can be your senior faculties, it can be other faculties who have already done questionnaire research, or it can be somebody outside your college also who's good in questionnaires designing. So you can contact them, they will become experts for content validity. Face validity means looks good to me. The extent to which a measuring instrument appears valid on its surface. Just by looking at it, you can say the questionnaire is valid. That is called as face validity. Each question or item on the research instrument must have a logical link with the objective. So face validity depends on the readability, feasibility, clarity of wording, and layout and style. Coming to criterion validity, it refers to the extent to which scores of a particular instrument relate to the gold standard. So whenever you are looking for criterion validity of your questionnaire, compare it with your gold standard. The measuring instrument is called criteria. So criterion validity can be of two types: predictive validity and concurrent validity. Predictive means prediction of the future, your future performance. So for an example, entrance exam, your entrance exam, what you give, NIT. NIT is your exam which you give not for your to understand how much is your knowledge, but to understand whether you are going to get a professional college or you are going to get admission to a particular college, or your performance will determine the later performance in a professional college. That is called as predictive validity. For an example, if I'm asking somebody about the sugar exposure, I am thinking whether it is going to help in developing the caries or not, whether more of sugar will cause caries development or not. That is called as predictive validity, to predict future performance. Concurrent means present performance. What is to estimate present performance of person's ability at a present time and not predicting future outcome. For an example, your professional college exams, your first year or second year exams. Another example, measuring the DMFT, decayed missing field tooth for caries experience. That is your present scenario, right? So that is called as concurrent validity. Another example, if I'm talking to a patient and I'm asking how many cigarettes do you smoke in a day? That is a concurrent validity question. But if I'm asking, do you plan to quit your tobacco? That is becomes your predictive validity. Coming to the last validity, that is construct validity, that ensures the measure actually measures what it is intended to measure, that is the construct, and not other variables. So use a panel of experts familiar with the construct validity can be assessed. Coming to reliability. Now reliability is also called as reproducibility. If you are able to reproduce the same results using that instrument every time you do the research is called as reliability. So ability of a questionnaire to create reproducible results is called as reliability. So reliable, if we get same or similar answer repeatedly, is called as reliability. Though it cannot be calculated exactly, it can be measured by estimating correlation coefficient. So there are different methods of assessing reliability. It can be kappa statistics, or it can be Cohen's alpha. It can be Pearson's correlations or Spearman correlation. There are different methods, statistical method to go with reliability. So there are 4 types of reliability. Inter-rater reliability. Inter-rater means there are 2 observers and asking same questions to same participants and check if they are getting the same response. So if they are getting the same response from the same participants, it means it is reliable. Inter-rater reliability or inter-observer reliability or inter-examiner reliability. All are same. Test-retest reliability means it is also called as intra-examiner reliability. Intra. One participant, when you are doing, I'm getting the response today. And after 1 week, again, I'm asking the same participant the same question. And if I'm getting the same response, it means it is reliable. So there is only one examiner here. Only one. Here there are 2 examiners. So inter-rater and intra-rater. Then comes parallel form. Parallel form means there are 2 questionnaires, similar questionnaires. Only the questions are reshuffled or something like that. Both should be equal. Similar response should be will be getting. That is called as parallel form reliability. 2 different forms, similar, questions are reshuffled, or the objective of the forms are the same. Asking those 2 questionnaires, giving those 2 questionnaires to the same participant, and then we check whether we are getting the same response or not. That is called as parallel form reliability. And the last one, reliability, is internal consistency. So for this, what we do, we divide the questionnaire into 3 different attributes. Imagine 3 different attributes. So there are 1 to 7 questions here. There are 1 to 5 questions here and 1 to 10 questions here. And we compare the response of these 3, whether we are getting the same response or not. That is called as internal consistency reliability. So to summarize reliability, we do a test-retest reliability. Split half is for internal consistency and inter-rater reliability. So correlation, Pearson's coefficient we do for test-retest. Cronbach's alpha, we do it for split half. And in this inter-rater, we check for agreement. How much % is an agreement between the raters, between the examiners? So in a questionnaire study, there are a lot of bias, no saying bias and yes saying bias. If you ask some questions to the participants, some have a habit of saying no most of the times. Some have a habit of saying only yes. So that will lead to a bias. Response fatigue. If you ask so many questions, 1 to 50 questions, at the end they will say, oh, whatever is the response, let me give it. They will not consider, they will not think over. They are fatigued. They are, they are tired of giving responses. End aversion. There are various options, 1, 2, 3, 4, but some people have a habit of not giving response to the last options. They generally give on the first or second options. That is called as end aversion. There is a bias called as positive satisfaction. By answering some questions, if they get positive satisfaction, that is the response they are going to give. Faking bad, faking good. Some people have a habit of faking bad. They want to show that they are very bad and they are very rowdy kind of a people and they are very arrogant and they are very strong people. So they will fake bad. Especially when a male researcher asks questions to a male participant about, let's say, about drinking or smoking habits. So he will show off. He will say, yeah, I smoke a lot. I smoke 20, 30 packets per day. That is called as faking bad. Some have a habit of faking good. So if there is a female researcher and asking same question to a male participant, then he will, even if he smokes 20, 30 packets, he will say, no, madam, I don't smoke at all. So that is called as faking good. Unacceptable disease, unacceptable exposure. So if you ask certain questions where the disease is unacceptable by the patient, then he will say, no, I never had this kind of disease. If you ask some patients, whether they are exposed to certain exposure, some etiology, which are not acceptable by that particular patient, then he will say, no, madam, I'm never exposed to certain things, these kind of things. Then some cultural differences can lead to some bias and technical jargons. Some questions you cannot ask. Some people will not know what is a composite. Some people will not know what is amalgam. They will say chandi or masala or something like that. So don't use the technical terms when you are asking certain questions to the participants. So in a nutshell, I would like to say a questionnaire can be reliable but invalid. However, a valid questionnaire is always reliable. So keep this in your mind. Ask only necessary background questions. Avoid sensitive and embarrassing questions. Keep questions simple and straightforward, and do not ask questions that turn off the participant's spirit. So these are some of my references. You can go very well read these. There are different types of, these are articles on books where you can understand how to make a questionnaire, how to draw a questionnaire, how to validate and do the reliability testing of a questionnaire. But one thing, please understand this, it's not very easy to do a questionnaire study. You have to validate the questionnaire, do proper validation, do proper reliability testing, and then only go with a questionnaire study. Just for namesake, don't do a questionnaire study. So thank you so much. So do you have any questions? You can ask me right now.
Please unmute and ask anybody if they want to ask.
So how
Unmute.
is this cultural adaptation of the questionnaire done? Is there any procedure for that?
No, ma'am. Actually, no procedure as such. You have to understand, you have to take the logical response, whatever response is there pertaining to that particular culture or that particular ethnic group of a questionnaire. But generally in a questionnaire, don't go with a, what do you call, adaptation. Don't ask cultural questions or social questions or political issues questions when you are doing questionnaire study. People, you don't know how people might respond. And if you're doing some studies in which this particular question is not applicable for that particular group of participants, then you can very well remove it. And some topics, you have to understand the cultural surroundings, like for an example, if it is about a diet or a fooding habit, then breakfast mein vada pav is what we eat in Maharashtra. So that you can do your own changes and do a pilot testing with some participants, some 5 or 10 patients or 10 respondents, and see what response you are getting. If you are getting proper response, if there is no issues, then you can very well carry on with your study. Am I clear, ma'am?
Yes, and can you throw some light on this mixed method studies?
Yeah, mixed method studies. Now there are of two types basically. In a mixed method study, we do qualitative research also and quantitative research also together. So some people they start with qualitative and then second phase they go with quantitative. Some people they do quantitative first and second they go with qualitative. Now these are two different methods of mixed approach. Now, when you don't know what are the questionnaire you should ask, you don't have an idea of what questions we can ask from the participants. First, go with a qualitative research. So you will understand what are their problems or what are their issues. And from their qualitative research, you can make a questionnaire for quantitative research. This is one type. Some studies, when you know these are the problems, but you want to go into the depth of that result. You know, you want to learn more about the results, what about the response. So first they will do a questionnaire study, and from there they will select participants who can give better in-depth results, who can give better in-depth response. On them you will go with a qualitative research. Am I clear, ma'am?
Yes, yes. Thank you so much.
Thank you, ma'am.
We need few more questions are there in chat box. If you possible, please take.
Yes, sir. 1 second.
Should I?
I'll come to sir. I'll come to the chat box itself. Yes. How do we analyze open-ended question? Yes, ma'am. I think I've already answered this. Open-ended questions, you don't have to analyze. Whatever response in your manuscript, you can give a space for open-ended questions, and whatever response they have given it, you can just write down those responses. Or you can code also. Later, you can do coding of the open-ended questions. If you find the open-ended response are similar to each other, then you can make a special coding for them and then analyze those open-ended questions. Okay, so that is what we do. Now, another question by Jayashree madam. Which type of questionnaire is better, structured or tailored type? Say, for example, if I'm directed towards a dental pain questionnaire. Now, dental pain questionnaire is pain is something which is very subjective. You know, for pain for me and pain for you will be different. The level severity of pain is different. Now, there are already various scales. Dental pain scales are already there. So you can use those scales if you are using dental pain as your objective in your study. Or if you want detail about the pain, like what are the different types of pain? Do you think it is a throbbing pain or sharp shooting pain or pain while sleeping or what? You want details about the pain, then you can go with open-ended questions. But the best method will be your scale, dental pain scale, like VAS scale or Wong-Baker scale or any other type of scale, because it will be easy for you to statistically analyze later. How to validate the questions of questionnaire if we frame our questions? Yes. So there are various methods of validation. The first simple method is expert validation. You have to catch hold of 5 or 7 experts and ask them whether that particular question is acceptable or appropriate or not appropriate. You have to give that questionnaire to the 5 experts, ask them whether it is appropriate or not appropriate. Then do a pilot testing on patients, check the response. If you are getting response and the patients are not asking any doubt and all, then again it is validated. Then you compare your questionnaire with the gold standard questionnaire. Same 2 questions, give it to the patients, both the questions give it to the patients, and see if the response what you are getting are similar in both the questionnaire. then that way you can validate a questionnaire. How many minimum to maximum questions to be asked for our questionnaire articles? There is no number as such that this much is a number, 5 or 10 questions only you can ask. No, it's on your thinking, your logic thinking. See, 10 questions is also enough to obtain the response or proper result. Sometimes even 100 questions are not enough to do that. So it depends. Don't keep too many questions because as I told you, there will be bias. If you are giving me a questionnaire, I will never fill it up because I've already done a lot of questionnaire response, given response to many people. So people are not very much willing to go with it, no more questions hereafter, no more questionnaire studies and all. So don't keep many number of questions in a questionnaire. You can keep it very simple. Ideally, keep a 15, 20 question. What we researcher will think of 15 to 20 questions we can keep in a questionnaire study. Any other questions? Anybody? And is my answer satisfying for everybody?
Yes, Vinay. Vinay, we'll take some 10 minutes break and then
Chalega,
again
sir,
log in at 11 o'clock.
Yes, sir.
You
Fair
take
enough.
break.
Yes, sir. 10 minutes. Yes.
Yeah. We'll again log in at 11 o'clock. Okay.
Sure, sir.
Bye.
Bye. Thank you, guys. Thank you, sir.
उसको तभी ठीक
Yes, ma'am.
Like I wanted, like, is there any criteria? In which case do we go for self-administered questionnaires, and in which case are they interviewer administered? Like, is there specific criteria for this?
Okay. Now, it's always good to go with the interviewer administered questionnaire. When you are asking questionnaire, you are getting response and you are writing it down or you are marking in your questionnaire. But in certain scenarios, when you are the only investigator and there are so many we give the questionnaire to the students, to the kids. They take it home, they fill it by themselves, they bring it back and give it to the teacher next day. So in that scenario, you cannot do an interviewer based. You can only do self-administered. But it's always good. Sometimes the participants can ask you doubts. They will not be able to comprehend some questions. They might ask you and you will be able to answer them. You will be able to make them understand the question. So that time interview based is very good. But if your sample size is too much, then go with a self-administered questionnaire. Nowadays, the Google form which we do, the Google form online questionnaire, it's all self-administered, right? You're sending it to all the participants, they are filling it up and sending you back. So that is a self-administered. So it's always good to go with the interviewer based when the patient is in front of you, when the sample size is less, then you go with the interviewer based questionnaire or else self-administered.
Yes, thank you.
Welcome, ma'am. Anybody has any other question or should I start with the next session? So for next session, I request everybody to have your laptop on. If you are not using laptop or computer, if you are using your mobile, please have your laptop or computer with you because we are going to do some group activities together with the lecture. And so that it will become easy for you to enter your data in an Excel sheet format. It will become easy for you to understand what to do, what not to do when you are entering your data. Because after all, it's all about data. Once you collect the data, you have to enter the data and then only it will go for analysis, statistical analysis. And whenever you consult a statistician for your statistical analysis, he will love to have a data in an Excel sheet format. So we are going to understand how to enter the data, and believe me, no statistician will tell you that I will enter your data. Data entering is your job. As a researcher, it is you who has to enter the data by yourself, and don't expect a statistician to enter the data. If he enters also, he will charge you heavily, like I do. So don't enter your using SPSS. SPSS is one software, is a statistical software which is used by the statisticians to analyze your data and come out with a result. Okay, so I will demonstrate because I don't think you will be able to use SPSS since you don't have SPSS, and SPSS is very expensive. We cannot afford SPSS per user to operate SPSS. If you are rich enough, you can please buy it. Buy it and give it to me. I will use it. So I don't think it will be good enough for you to do workshop or hands-on on SPSS. However, I will demonstrate how to use SPSS. So let's straight away come to the good part. Let's skip to the good part rather. We'll come down to the topic computer assistance in data analysis, Excel, EpiInfo, and SPSS. So It was supposed to be in good afternoon, I think, and now it's good morning, still good morning. So it doesn't matter. What is the meaning of life? I don't know, the computer are down. So it means everything we do in our life nowadays is either computer or mobile, or everything is digital. Everything is online in our life nowadays. So I'll be talking about computer assistants and what was the life before computer. When there was no computer, what was the life? So window was a small square hole in a room. Mouse was an animal. File was an important office material. Cut was done with knife and paste was done with glue. Virus was a flu. Application was something written in paper. Keyboard was a piano. Hard drive was an uncomfortable road trip. Web was a spider's home. And Apple and BlackBerry were just fruits. So this was a life before computer. After computer came into market or the mobile came into the market, everything changed. You are working on Windows, you have a mouse with you, the file is your folder, the file and folder, cut and paste, everybody knows about it, cut, copy, paste, that has become our life. Virus, you know what is a virus in a computer? Application is your app, your Facebook, your WhatsApp. Keyboard is nothing but your keyboard in your computer or a laptop. Hard drive is a hard disk. Web is your internet portal, and Apple and BlackBerry are not just fruits, they are mobiles nowadays. So this is how your computer looks like. If you haven't seen your computer, if you haven't seen a computer, this is how it looks like. Now everybody will be using a laptop, so you will not be having most of it. You will have a flat panel display, output device, you have a speaker, a keyboard, a mouse, a desktop. And apart from these are the things which are mandatory for nowadays, especially for postgraduate students. These are the things you require apart from your computer. You will require a printer, you will require a pen drive, you will require an MP3 player, you will require a headphone, you will require a Bluetooth mouse, a webcam, a pen drive or micro SD card, a speaker, and all those things. So these are the accessories which are mandatory nowadays when you are using a computer, you are doing something with the computer. So basically the computer will be something which you will sleep on, you'll sleep on your computer. You will eat with your computer. You will dance with your computer. You will love your computer so much that sometimes you are going to hate your computer. You're going to break your computer. So computer will become your best friend. Your computer will become your life as a postgraduate or as a person who is doing research. So there was a study done by Dr. Hari Kumar K, and he found out that 37.5% people use computer in a dental education is to prepare seminars. And 35.4% was for communication, for chat, for email, for social networking. That is why they use computer. So that was a computer and internet use in dental education. So let's start. So if you have a computer right away, there is a button called as, you can see that below one, there is a Windows button here. You click that Windows button, you will go to program, you will go to Microsoft Office, and you will open Microsoft Excel 2020. Or you can do a right click and then go to, then you can go to new, and from new you can come down to Office Excel worksheet. This is how your Excel workspace looks like. So you have a file, edit, view, insert, format, tool, data, Windows, help, and Acrobat. This was the previous version which has been used. Okay. Then this is your Excel sheet home page. You have a small cell, you have a row, you have a column. So everybody is having a computer with you. Can you come down to your home page? Can you come down to your home page, please?
Yeah.
Everybody has clicked the home page.
यहाँ ये सब गूंगे हैं, छोड़ो.
Did you click the home page? Did you get something? Did you get this? Open your Excel sheet now. Everybody can open the Excel sheet. So small boxes in an Excel sheet is called as cell. And the horizontal row of boxes are called as row. And you have a column. Vertical ones, the boxes together, vertical is called as column. So this is the second part of your home page. Then you have next, you have insert. Can you see your insert? Now this is very important because this is a section where you can make bar diagrams and pie diagrams and line diagrams and scatter plot and all the charts you can make from your insert section. Remember this, the insert section. Okay. Then you have a page layout, however you want an orientation, you want a portrait or a landscape orientation, you want to keep a background, you want to have a margin, everything you can do from a page layout section. Then there is a section for formula. Believe me, most of the statistics can be done using your Excel sheet. All t-test, chi-square test, Anova test can be done using your Excel itself. This is a section where you can use all the tests. There is a section for auto sum, financial section. If you are making an Excel sheet for financial reasons, you have mathematics and trigonometry, date and time, everything can be done using this section. And there is a column here, data view. There is a data view. Can you see this data view? In this, you can sort your data based on your alphabets. For an example, if you're writing names of a participants and you want from alphabetically, you want from A, B, C, D. So you can click here and sort A to Z. So you'll be having patient's name from starting with A and ending with the patient's name starting with Z or Z. You can filter the data using this section. You can group and ungroup the data. Then everybody knows about this, cut, copy, paste. Everybody knows, right? Ideally, we should not use this. You should write your own things. Don't cut, copy, paste. But of course, sometimes we need to do cut, copy, paste when you're editing your data, when you're copying your data from other places. You can increase the width of the cell just by dragging it. I will show you how to do when I do the demonstration. You can increase the width of the cell. So this is the size of the cell, you can increase by dragging it. Then your option of merge and center, you can take two cells and you can merge them together. 3, 4, 5, 10, 20, how much ever you want. If you want to merge the cells, you have to click here, merge and center. Then you have an option of down, middle, up alignment. You have an option of left and right and justified, centralized alignment. You have an option of wrap text. Wrap text means when you're writing it down in one cell, everything will not come. So you have to wrap text. So all the part what you have written will come in one cell itself. That is called as wrap text. Then you have an option of format numbers. So if you are putting data as a currency, in rupees, then you have to click currency. If you are doing some accounting data, if you are doing some percentage data, click percentage. Then all the values will be in percentage. If you are doing some fractions or time, values are your data is in time. So automatically it will come in time. Cell borders. You can border the cell. Small cells, you can make the borders for it. For better understanding, for all this, you can border the cell. So you can click all borders, you will get it. Coloring. You can color the cell and you can also color the text, whatever you are writing. If you are writing your name, you want it in red, then you have to go to A and click here. You will get options of all color and you can click it red. So your name will be in red. If you want to color the box as yellow, click here. The box color will become yellow. Click, control and drag down. Now imagine you have 1,000 participants in your study. You cannot write 1, 2, 3, 4 till 1,000. Just write 1 and drag it till 1,000. Automatically everything will come. You don't have to type 1, 2, 3, 4, 5 till 1,000. Automatically you can drag down, it will come. Sort and filter. If you want to sort smallest number to the largest number or largest to smallest, go to sort and filter. Coming to different type of studies and what data, how you have to enter the data. So imagine I'm doing a study, a questionnaire based study. I'm using a questionnaire. And my study is to whether second BDS or third BDS student are reluctant to treat non-HIV or AIDS patient, right? So I want to find out the knowledge of HIV and AIDS among BDS, which may give me insight to suggest to make changes in the teaching curriculum. So I will design a questionnaire. So my questionnaire will have part 1, which will have demographic details. Part 2, I will have main questionnaire on knowledge, attitude, and practice. So imagine this is my questionnaire. My questionnaire looks like this. So what I will do for data entry, I will code the data. For male, I will code it as 1. Female, I will code it as 2. For class 3 BDS, 1. Final BDS, 2. Interns, 3 coding. And for every question response option, if the option is A, I have coded as 1. Option is B, I will code as 2. Option C, I will code as 3. Because in Excel sheet, when you give it to the statistician, he will ask you codes, numbers. Because alphabet is not read by SPSS. SPSS will not read your words. It will read only the numbers. So better code those numbers. Code your alphabets, whatever you have. So my data entry will be like this. So first column, I have serial number, then which class 3, class 4 interns, what is the gender, male or female, and what is question 1 ka response, question 2 ka response, question 3 ka response, everything coded in numbers. Did you get my point? Everybody got my point? Okay, good. Now I am doing I'm giving another example, and I want to see knowledge, attitude, and practice of HIV/AIDS among dental and medical practitioners. Now I have 2 groups. Before this, only I had 1 dental. Now I have dental and medical practitioners. So everything will be same, only your branch will change. In branch, I will code 1 as dental and 2 as medical. Rest everything you will write the same. Same serial number, same age category, gender category, branch, designation, all questions, and then response coded. Questions you can write in alphabets, okay, in the words. But response should be coded. All response is coded. When you're doing a clinical study or a cross-sectional study, for an example, I want to measure gingival index, plaque index, and compare with frequency of brushing, age, and gender. This is my study. So my Excel sheet will look like this. I have a serial number, I have an age group, I have gender, I have frequency of brushing once, twice, more than twice. Then plaque index and gingival index values. So you can see everything is coded, all are numbers below, only on the top it is in alphabet or words. Rest everything is in numbers. When you are doing a cross-sectional which is observational, okay. For an example, I want to measure dental anxiety using some scale. Let it be DAS scale, DASS, and correlate with age, frequency of dental visits, gender, socioeconomic status, etc. Then my Excel sheet will be like this: age, age range, gender, socioeconomic status. I have given code. Frequency of dental visit 5 times. Past dental experience, yes or no. If yes, 6A, 6B, total anxiety score is 11, 28, 12, 30. This is my Excel sheet when I'm entering data for a cross-sectional observational study. When you are doing a case control study, I hope you know what is a case control study. It is from effect to cause study. It is a retrospective study. So imagine I have 10 people with lung cancer, 100 people with lung cancer, 100 people without lung cancer. And I'm asking about their smoking history, frequency of smoking, duration and type. So this will be my study design of a case control study. I have 2 groups. I have a case group, I have a control group, and I'm looking at their exposure, whether smoking present, absent, present, absent. So my Excel sheet will be like this. I have a serial number, I have an age, I have a habit of smoking 1 and 2, yes or no. And frequency of cigarette per day, duration of cigarette, and lung cancer, whether yes or no, 1 or 0. That is my coding. So in this we'll calculate the odds ratio. Now everybody knows how to calculate the odds ratio? Do you know how to calculate the odds ratio?
Yes, sir.
Okay, I want everybody to calculate the odds ratio and put up in the chat box what is the score. Calculate the odds ratio. The one who is calculating first will get something from me. So the formula for odds ratio is AD by BC. A here is 76, B is 24, C is 4, and D is 96. Formula is AD by BC. A for apple, D for dog, B for ball, and C for cat. AD by BC.
वो टाइप कर आंसर कर.
Yeah?
They are doing.
I can see the chat box and I got an option. 6 is wrong. Vishwajit
76
Lokande.
into 24 divided by
Correct.
24 into
Ritesh
4
Gowli.
करना.
76, Swati Joshi is correct. And everything else wrong. So Pritesh, can you interpret 76? What do you mean by 76? Odds ratio is 76. Can anybody interpret odds ratio 76? All those who have answered 76, can you please interpret what is 76? Can you unmute yourself and say what is 76 odds ratio means? So 76 means, this is one time I'm telling you, I'm interpreting it for you. And remember this always. Whenever you see a odds ratio of any number, it means 76 odds ratio in this study means if there is a habit of smoking present, then there is 76 times the chance of developing lung cancer in comparison to people who do not smoke. So that is an interpretation of odds ratio. 76 times the chance of developing lung cancer for people who smoke in comparison to people who do not smoke. Am I clear?
Yes, sir.
Perfect. Okay. Let's go to the cohort study. When you are doing a cohort study and you have same cohort study, you know what is a cohort study? It's a prospective study where you go from cause to effect. So now in this, we don't have patients of lung cancer. We have patients with smoking habits. We want to see whether they are going to develop lung cancer or not. In case control study, we have patients of lung cancer. We wanted to go backward and see whether they had a habit of smoking or not. So in a cohort study, we move forward. So cause to effect. So similarly, with characteristics, without characteristics, whether they will develop a disease or not develop a disease. So you will enter the data same like that, like a case control study. You will have a serial number, you have an age, habit, frequency of cigarette smoking per day, duration, and lung cancer. So in this cohort study, we calculate RR, relative risk or attributable risk. Coming to randomized control trial. For an example, let's carry out a randomized control trial to check the efficacy of herbal toothpaste with XTM, some toothpaste, X. The GI of for gingival index of adult 35 to 44 years. So this is how you draw a diagram for your randomized control trials. So you have 120 patients, 60-60 divided into two groups. You'll calculate gingival index at baseline and then at 1 month. So your Excel sheet you will make like this, simple Excel sheet. Groups, gingival index. Group 1, group 2. What is the gingival index? 1.1, 2.1, 1 like this. But if your comparison for one group, if you are going to compare only one group from baseline to 1 hour, like 100 diabetic patients, you are giving a drug at baseline, what is the sugar level? At 1 hour, what is the sugar level? Then your Excel sheet will be like this. You don't have to make a group ka column because there is only one group. So only write the values, baseline and sugar after 1 hour. Then if you are comparing between two groups, for an example, you are comparing drug X with a gold standard drug from baseline and after 1 hour, like this. 100 diabetic patient, you are giving gold standard drug. 100 diabetic patient, you are giving drug X. And you are comparing blood sugar level, baseline and sugar level at 1 hour. Then your Excel sheet will be like this. Make a column of group and baseline sugar, sugar after 1 hour. So you have group 1 and group 2. Two drugs, drug 1 and drug 2. Now, common mistakes while entering your data in Excel sheet. Can you see the mistakes here? "23 years male." You have to write male in a separate column, not in the same column, same box. Don't write years, just write the number 23, 45, 42. Designation, they can be either medical or dental. They cannot have two designations, medical as well as dental. So make only one column. Give a code of dental 1, and medical 2. So one column, code 1 and 2, 1, 1, 2, 2, like that. Don't write A, B, C, D. I told you have to code them 1, 2, 3, 4. Now, there are some formulas in Excel sheet. A1, A2, you can add, you can subtract, you can divide, you can multiply, and you have something called as caret. Caret means 2 to the power 4. So you cannot write 2 to the power 4. You have to write 2, click caret. Caret is one option you will get, and write 4. So it automatically becomes 2 to the power 4. You can calculate median using Excel sheet. You can calculate mean, minimum, maximum, standard deviation, first quartile, third quartile, everything can be calculated. So if you want 2 to the power 3, then you have to write 2 caret 3. If you want a square root of 81, you have to write SQRT in bracket, write 81. If you want cube root of 27, then you have to write 227, put caret, bracket, 1 by 3, close the bracket. Then you will get the value. You can calculate the mean. You have to click on the blank cell and drag all B2, B21 and press enter. You will get a mean value. I will show you how to do it. You can calculate median also same way. You can calculate mode also the same way. You can calculate standard deviation also using Excel sheet. You can calculate variance. Variance is a measure of dispersion. It's a square of standard deviation. You can count how many responses are there. What is the total number of observation? You can do counting also. You don't have to manually count 1, 2, 3, 4. No. So this is an Excel sheet. You have a control group. You have an experimental group. Go to statistical part. There you can have a t-test. You can see you will get an option of t-test. Everybody go to more functions in your Excel sheet. Go to t-test. When you click the t-test, you will ask you what you want. So you will select C2 to C11 and D2 to D11. One tail test, you press OK. You can also do Anova. Now for Anova, you will need one extra thing here called as data analysis. Download this data analysis. It will automatically come to your Excel sheet. It is a free software, but it will only come if your Microsoft is genuine. If it is a pirated version Microsoft, you will not get data analysis. If you have a latest Microsoft, then you will automatically get data analysis. So you can also do Anova using it. So Anova also you can do using Excel sheet. So this is how your Excel sheet results will come. You will get a p-value here. In the Excel itself, you will get Anova. Coming to EpiInfo. EpiInfo is one statistical software. It's very easy to use. It's just like Excel sheet. So EpiInfo has been in existence for over 20 years and currently it is available for Microsoft Windows also. So in EpiInfo, this is a website, cdc.gov/EpiInfo. This software is from Centers for Disease Control and Prevention, CDC in Atlanta, Georgia, US. So in using EpiInfo, you can make your own questionnaire using EpiInfo. You can enter data directly into EpiInfo. You can create maps. You can do some statistical calculation like sample size and all. And you can do complete analysis. Statistics you can completely do using SPSS. And you can also draw graphs, charts. Visual dashboard is there. You can very well draw charts and graphs, pie charts and all those things. So this is how it looks like, your front page of EpiInfo. Coming to SPSS, SPSS is one software. First it came in 1968, and today currently we have not 25, it's 27. Today we have a 27 version 27 of SPSS, and it is officially taken by IBM. So it is IBM SPSS solutions nowadays. So all type of statistics can be done using SPSS. You can do descriptive statistics, bivariate, numerical outcomes, or any linear regression, factor analysis. All type of statistics can be done using SPSS. So SPSS also looks just like Excel sheet. It has a data view. It has a variable view. And you can do open the data. You can do Excel sheet. This is how you get the results in SPSS. You can export SPSS data into Word document also. There's an option called as export. You'll get the results in Word document. And this is how the result of t-test and Anova you can see in SPSS. You will get significant. Significant means the p-value. This is the p-value, 0.311. 0.059. This is post hoc test for Anova. So computers and internets are important. Use wisely. You won't die. You will just shut down or go offline. And of course, sometimes you get tired of your computer. I hope this is not tiring. I hope you understand something. We'll go to the demonstration part now. I will demonstrate few things in Excel sheet. So let's go to demonstration. I will share my screen now, and I'll show you how to use your Excel sheet first. So let's go to the Windows button. Let's go to the Excel 2013. I'll open a blank workbook. Everybody, please do it with me, then only you will understand. So this is a blank notebook of Excel sheet, Microsoft Excel. Now there is a home button. There is an insert button, page layout, formula, data, everything, references, everything is there. Now I'll start with the first cell. I will write serial number. Now below that, I will give the number 1. Now click 1, you will get a plus sign here. Can you see this plus sign? Below 1. Just drag it down. Hold and drag it down. All will become 1. In the corner, there is one box, autofill option. Just click that. Instead of copy cells, go to fill series. Everybody understood this? Okay. Now, next I will write serial number. Let's write next name of the participants. So I will write some name. Amar, Akbar, Anthony. Can you see the name is coming like this? It is overlapping the next cell. It is not coming into the next cell. It is in the single cell only, but it looks like it's overlapping the next cell. So there are two things you can do. You can go here. Click this. There is an option like this. You can drag the cell. You can increase the width of the cell. Or else, click this, go to wrap text. When you go to wrap text, everything will come in the box. Am I clear, everybody? Okay. Next, I'm writing age. Age of the first participant, Amar Akbar Anthony. The age is 29 years old. You don't have to write like this. Just write 29. And on the top, you can write in a bracket in years. And do a wrap text. Am I clear, everybody? Do you have any doubt? Then let's go to gender. Instead of writing male, I am giving a code 1. I am giving a code 2 for female. You should give a code like this. Now I don't want in black. I want the name Amar Akbar Anthony in red or any other color. So I'll go here, click this, choose red. So everything will become red. I want the above section, I want in the whole section, I want a background of yellow. So I'll fill color, I'll go to yellow. Am I clear, everybody? Anybody has any doubt can ask me right away. I want to merge these sections, F, G, H, I, J. I will drag and select all and I'll do merge and center. And I will write dietary habit. Okay. Now I have age here. Another participant age 30, 15, 16, 40, 45, 98, 20, 32, 5. I want to have numbers alpha smallest to largest. So what I will do is I'll go to data and here I will select I'll go to home, smallest to largest. So I will all have from smallest to largest. I don't want smallest to largest, I want largest to smallest. Now I have gender here, 1, 2, 1, 1, 2, 2, 2, 1, 1. Now I want to select only males, 1. So I'll find and I'll go to filter. I will go to filter here, shorten filter. They'll ask you give an option of filter. Here I will go, I'll get an option of filter. Click that. I will select only 1. I will deselect all other. Select only 1. Okay. So I'll only have data of male. Am I clear, everybody? Do you have any doubt till now? Do you have any doubt? Anybody, postgraduates, you're not responding well.
Yes, sir.
No doubts, Vishwajit?
Sir, can you repeat one?
Which one? You want me to repeat the
Last
filter
one.
one?
Last
Filter.
one, sir. Yes, sir. Yes, sir.
Okay, I'll do. Okay. Now select this column D. Click on the top D. Go to sort and filter. There is an option of filter. Click that. You will have an option of filter here. Automatically it will come here.
Yes, sir.
Now click in this. Deselect all. Select only one. And do OK.
Yes, sir. Got it, sir.
Anybody else has any doubt can ask me right away. So I want to see the sum of all the age. I want to check what is our total sum.
Right. Okay.
Adding up all the ages. So I'll go to auto sum. Did you get this? I will click here. I want to add all the ages. Age. So I'll go to auto sum. Automatically, when you click to auto sum, you'll get the sum C2, C10. Automatically, the cell number will come. Just press enter. So total sum is 310.
Yeah.
Okay. Now let's draw some graphs. I'll show you how to draw a graph. Now I have a control group. I have an experimental group. Okay. Now in the control group, let's tell the mean height, mean bone height, or let's talk about gingival index. The mean gingival index is 2.5. And the mean gingival index of experimental group is 1.7. And this is a mean value, mean GI. So what you do, go to insert, drag this, hold everything, go to 2D columns or go to 3D columns, however you want. When you click that, you will have a graph. So this is a bar diagram. If you want the values on the top, click on the plus. There's something called as data label. You'll get the values on the top. You can change the color of this bar also. If you want, you don't like the color. So click on this, sorry. If you don't like the color, just click on this or do a right click. There is option of fill. I want it in red. Click on red. Then change the color of the bar. So all these things can be done in an Excel sheet. Now another example. I'll show you one more example of t-test. I'll do t-test here. So I have a control group. First patient, the gingival index is 2.5. Second patient, the gingival index is 2.7. For experimental group, it's 1.1. Third patient, it's 3.2. It's just imaginary numbers. So don't worry, 0.9, 0.9. Third is 2.5, 2.6, and this is 2.5. And fourth patient, the value is 3.1, 2.9, anything. Now I want to do a t-test here. So what type of t-test I will do? I have two groups. What type of t-test you will be doing?
Pair t-test.
Louder, please.
Paired t-test.
Unpaired, not paired, because these are two different groups. Same group, not two times, two different groups. You have a control group, you have an experimental group. So you will be doing unpaired t-test. So what I will do is I'll go to formulas. I'll go to more functions. There is the option of statistical. I'll go to statistical. I'll go down, 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 then down, down. Then you have option of t-test. Click on t-test. Then you will get this window. So for array 1, I am selecting control groups. So you select these. Automatically will come M2 to M6. For array 2, I am selecting experimental group. I'll select this. Automatically you will get N2 to N6. And I'm doing one tail test and type is 1. 1 means 2 sample equal I'm doing. I'll run OK. So this is your value, t-test value. So 0.038. So instead I'll do here, same thing. I'll do a t-test here. I'll click here. I'll go to more functions. I'll go to statistics. I'll go to t-test. I'll have an array. First group is control group. Second group is experimental group. And I'm doing a t-tail type. So your test will be 0.038. So there is a statistical difference, right? It is less than 0.05. So your p-value is this. Getting my point, everybody? So a t-test says there is a difference in control and experimental group. Am I clear, everybody? You want me to show anything else in the Excel sheet, or should I go to SPSS?
So can you please repeat for the p-value thing?
Okay. So I want to do a t-test. I'll go to more functions. I'll go to statistical. I'll select t-test. When you go, you get a drop down. In this drop down, you will have a t-test. Click on t-test. Okay. So first I will select array 1. So what is my array 1? 22. This is my selection, control group. Then I'll click on array 2. Array 2 is my experimental group. So I'll click here and select all these 5. I'm doing a one tail test and I'm doing type 1. Type 1 is nothing but type 1 is it's a student t-test. So paired, type 1 is paired one. So you can see the p-value, p is okay.
So, but we are doing unpaired t-test, no?
So in this student t-test, this is the result is. So that is a demerit of an Excel sheet. It doesn't matter.
Okay.
But the p-value will be same. The difference, anyhow we are calculating the difference. That is a good thing in SPSS, which I'm going to show it to you.
Okay.
So now the p-value is 0.038. Getting my point?
Yes, sir.
Anybody else, or should I move on to SPSS? SPSS is much simpler and much better. So let's click on the Windows button. Let's go to IBM SPSS Statistics. This is a software I have. You will not be able to do unless you have 5 lakh rupees. So I go to IBM SPSS. And don't feel that having 5 lakh rupees. No, ये लोन पे लिया हुआ है, लोन पे कर रहा हूँ. So Yeah. So let's open SPSS. So this is how SPSS looks like. Same like Excel sheet. Now in SPSS, there are two views, data view and variable view. Okay. Now let's take the same example which we had here. I'll just copy paste this. Copy. And in the data view, I will paste it here. Now I have to go to the variable view to write what is the value in data view. So the label is control and the second group was experimental. Okay. Am I clear, everybody?
Yes, sir.
Yes, sir.
So this is a control at baseline value of gingival index. And this is the experimental group ka baseline value of gingival index. Now I have another value. After 6 months also I am checking the gingival index. So in control group, after 6 months, the gingival index was 2.2, 2.3, 2.4, or 1.5, or 2.9. And the experimental group also I'll check after 6 months. So my value is 1.3, 1, 1.2, 1.9, 0.5. So this is my control group after 6 months value. And the fourth one is experimental group after 6 months ka value. Okay. Now I want to compare between the baseline values between two groups. So what test I will use? I want to compare the baseline values between two groups.
Two groups. It's more than two groups is Anova.
I am comparing two groups, not more than two groups.
Unpaired t-test.
Okay, good. And if I want to compare baseline and 6 months of only one group, what test?
Paired t-test.
Let's do the paired t-test first. So in SPSS, we'll go to Analyze and Compare Means. Then there is the option of Paired Sample t-test. I will click that. So control ka baseline and control ka 6 months. Experimental ka baseline and experimental ka 6 months. These are the pairs, right? I will select these. I'll just do OK. So this is a result which I'll get in SPSS. So control ka mean value GI is 2.82. Standard deviation is 0.311. Control 6 months 2.26. Standard deviation is 0.502. Experimental baseline is 1.82. And experimental 6 month is 1.81. Can you see in this box? The p-value is 0.038. And for the control group and for experimental group is 0.241.
Non-significant.
So for experimental group, there was no significant, statistically significant, no statistically significant difference change from baseline to 6 months in experimental group. But in control group, there was a statistical significance difference in gingival index from baseline to 6 months. Simple? Simple. Okay. Let's go to Let's take another example. This is the last example I'm showing it to you. Now imagine I am doing an implant. I'm doing a research on implant placement. So everybody knows there are three types of implant placement techniques, right? One is immediate implant placement, one is intermediate, and the third one is delayed implant placement, right? Everybody knows this, or I am the only one who knows this? Knows, yes or no?
Yes, sir.
So I've done an experiment. There are three groups, 10 participants, not 10, let's take 5 participants. And I've given them implant. The first 5 participants, I've placed implant immediately. Second 5 participants, I have placed implant, let's say after a week, after 15 days. And the third group of participants, I placed the implant after 3 months. And let me check the bone height change. So in the first group, the bone height change was 2.5, 3.5, 3.4, 2.9, and 2.8. Second group, which was intermediate, the bone height change was 2.7, 3.6, 3.5, 2.3, and 3.1. And the third group, which was a delayed implant placement, I checked the bone height change was 3.7, 4.5, 2.9, 3.9, and 4.3. So I have 3 groups now. The first group is immediate group. Second group is intermediate. And the third group is delayed. Am I clear, everybody?
Yes, sir.
Yes, sir.
So I want to see which treatment is better, whether immediate or intermediate or delayed. So
Anova.
3 groups, what use?
Anova.
Anova, perfect. Together with Anova, we have used something. I'll tell you what we are going to use. So for this, what we do is, in Spss, we arrange the values one below the other. So I'll cut the values. I will arrange it one below the other. Am I clear, guys? First 5 values are immediate, then intermediate, then delayed. And I will give them a code. 1, 1, 1, 1, 1 for first 5. 2, 2, 2, 2, 2 for the second 5. And 3, 3, 3, 3, 3. Okay? I'll go to the variable view and I'll give them the name group. 1 means immediate. 2 means intermediate. 3 means delayed. Am I clear, everybody? Then click OK. Now I'll go to analyze. I'll go to compare, means there is an option of one-way Anova. Click that. Okay, one more thing. So when I've arranged one below the other, the name will change. It is not immediate now, it's a bone height now. So I'll replace the name with bone height. I'll go to analyze, I'll go to compare, means I'll go to one-way Anova. Dependent list will be bone height. And my independent factor will be group. Okay. So before this, why not we check the mean values? What is a mean value? So to analyze, go to compare means, click on means. Your dependent list is height. Your independent list is group. Do okay. Can you see you're getting mean 3.02, 3.05 and 3.86. This is the average bone height in all the three groups. Am I clear? With the standard deviation and
Yes.
5 participants in per group. Now I will run Anova. I'll go to the dependent list bone height. I'll do okay. Can you see the p-value?
Yes, sir. Significant.
What do you mean by this?
It is 0.047 less than 0.01.
So it means,
It is significant, statistically significant difference.
then what does it mean? What is your interpretation now? Interpretation now. It means the bone height in delayed implant placement is more in comparison to other types. But can you tell me in between which group there is significance? There are 3 groups. It says there is a difference in bone height between the 3 groups. But which 3 groups? Between and intermediate. Is there a significance between intermediate and delay? Or is there a difference in immediate and delayed? We will not know. Right? For this, we will again go to compare means. We will go to one-way ANOVA. There is an option called as post hoc. You apply post hoc. There were various options of post hoc. Click on Bonferroni, continue, OK. So when you do Bonferroni, you find there is significant difference between immediate and intermediate. And even immediate and delayed also there is no significant. So when you compare all 3, you will get significance. But you compare 2 eyes, you will not get significance. Getting my point, everybody?
Yes.
Yes, sir.
So this is SPSS where you can do ANOVA. So that's it from my side. If you have any question, you can ask me related to SPSS or Excel sheet. Now teaching you SPSS can take 1 or 2 months to understand. If I start teaching SPSS, it's a very big thing, you know. So slowly you keep practicing, you will understand SPSS. I will not be able to teach SPSS in a day because it took me 5 years to understand SPSS. But if you have any doubt, you can ask me right away. I'm willing to explain you that. So I've done with the computer assistance and with the hands-on or group activity of SPSS Excel sheet. If anybody has any doubt, can ask me, and you can be a little louder because my computer's audio is not working properly. I need to buy a new computer now. Okay.
Any doubts? If you people have, please ask. Otherwise, we'll wind up. We'll go to the next. Finish. I think they are done. They don't have any doubts. If they have doubts, they will directly communicate.
Yes. If you have any doubt, you can directly contact me.
Yeah.
And I hope you understood at least something.
Yeah, definitely.
Statistics is one thing which is very difficult to make you understand, and I tried my level best.
Sure.
This is my contact number, my details, everything is in there. You can contact me whenever you want. Only when I'm sleep, I'll not be able to pick up your call when I'm sleeping. Otherwise, I can do that. I do pick up your calls.
But you didn't really pick up my call only since 2
Sir,
days.
sir, please. Sir, I pick up your call, sir. Since
Yes, kidding apart, joking apart. Thank you, Vinith. Thank you very much. It was really, you made everybody involved. Basically, everybody was involved. Yeah, sorry, one more question is there, boss. Sir, how much Dr. Vinay will charge? These are all personal questions. You should directly contact
also.
charges and all are dental में आके तो sir कौन कितना लेता है ऐसे बोलता है क्या? नहीं. All these questions are not directly you communicate with him. Hey, Shailay, Vinith, I answered is on
We'll
behalf
also
of
ask
you.
them
Don't worry.
charges. How much the charge?
No. For no quotation fee देते हो बाद में then you take the question. Hey, no, Vinith, relax. I answered his questions.
How much they charge for retainers?
Yeah, all these are confidential, man. You maintain some what you are. Okay.
Yes, sir.
Vinith, this doesn't come under the purview of the presentation. This paise wala. They let them come directly
Yes, sir.
and approach you. Clinic में आने का online consultancy is not allowed. No online for that is I answered on behalf of you. Hope you don't mind.
Yes, sir. No problem, sir.
Vinay, thank you very much. It was really wonderful. Actually, before winding up, I want to tell all participants, in fact, these resource persons who came on board yesterday, Dr. Chawla sir and Dr. Pranita madam has been on board because of Vinith. In fact, he was instrumental in getting all us on board. Thank you, Vinith.
You so
it was really, from bottom of my heart, I express my sincere gratitude to sharing your expertise. And everybody was involved. Everybody, I hope everybody liked your presentation and they were really involved. They were not just sleepy, and you made it very interesting. In fact, yesterday also everybody gave a very good feedback. Your presentation was very good. And thank you very much once again. I'll call you later.
Yes, sir.
Okay?
Thank you so much.
Thank you, Vinith. Thank you very much.
Ma'am. Thank you, everybody. Thank you for inviting and considering me for this workshop. And thank you all the participants for being interactive for the whole 3 days of, this is very important. We love participants who are very interactive. And I hope you learned something out of this research methodology workshop. And you have a wonderful faculty at your college who can very well guide you at any point of your difficulty, your research activities, your statistical part or whatever. And all the faculty members who are also present here, thank you so much for considering me and listening to me, for polite listening. And let's make it next time. Whenever you call, I'll be there, sir. Karibasapa,
Yes,
sir.
Thank you very much.
Whenever you call, I'll be there. Whenever you call, ma'am, I'll be there. Thank you, Dean, sir. Thank you for allowing me to give a resource, being a resource faculty in this. Thank you, guys. Thank you, everybody. And you rock.
Bye. Thank you.
So, thank you so much.
Thank you.
Now, am I audible? Yeah, good afternoon, everyone. Again, welcome once again. Again, I'm not making you boring. Whenever I am coming, mobile, these laptops will also, I don't know what to do these people. Yeah. So, we have done since 3 days research. Now, whenever we do a research, basically, what is most important is, I told last 2 days back, I should start with the idea. And the most important is, whenever you do a research, or whenever you start a research, most important thing which should be kept in your mind is, it should be published. It should be published. Keeping that in mind, only a researcher should start his journey. So you should have a very clear vision. You should have a, please mute yourself. Huh? I don't know why you people will do all these things with me. So you should have a very vision clearly that it's so that I am going to publish my work. So you should have a very proper vision, and with your aim and objective very clearly. You should have the ultimate goal of your research is to be published. For particularly postgraduate students, I am talking. This was not very much focused during our time. Now it is very much important because to our MDS degree, you should have made an attempt to publish an article. I think 1 or 2 minimum. The attempt is minimum, means you are supposed to, before sending to appear for exam, you are supposed to make an attempt for publication. So before going to write how to write a manuscript and all those things, let me tell you, this I made a note of this in during my introduction to research methodology also, because science is certainty, it's not certainty. Science is always dynamic. It keeps on again evolving. How? At incremental level. Because if you see, from past only we grow. So 3 pillars are there for science. Again, I will repeat: knowledge, method, and attitude. How we can accumulate or collect the knowledge? The most important way of accumulating or contributing for a profession is by doing publications. And the other 2 pillars for science which exist is methodology and attitude. What it means by methodology and what do you mean by attitude? Methodology means whenever you write your articles, it should be clearly detailed, in detail it should be mentioned. There should not be any. Why it should be clearly in detail it should be mentioned is because anybody, if you want to replicate, yesterday madam was saying 3 important requisites for experimental study designs: reliability, and acceptability for the participant. So similarly here, your subject as a researcher, you should allow yourself for critical evaluation, because many of us think that our study is the best. We usually have that. I have done study means that will be my best. No, with a proper methodology which is being laid down, and this mindset we should carry, that let us critically evaluate, because the research is what searching for missing truth. Something might be missed out from us, so that the knowledge which is being accumulated will give that gap which has been existing in the knowledge. So these 3 things are very much important, keeping in the interest of science, because we being a research scholars. So why we should write a publication? Why you will ask, sir, many of us are reluctant to write a publications, because in literature it is said that doctors and engineers are very poor writers. Poor writers. That is what literature says. We are not very good writers, and we always have that inhibition. We might not be a good writers. Yes, it is right. We are not a good writers, but in coming to a scientific article writing, we have got guidelines which we follow, which we understand. Then it will be very easy for us to write a manuscript. Now the era is publish or perish. Publish or perish. So we will be forced for sometimes to write publications because of getting some increments or promotions. All those things are that is called as self-interest. Apart from this, another one reason is there why we should do publication is altruism. If you don't do publication, then how science will evolve? How we will develop? How next it will be carried forward? If you do our work, and if you do our work, and if you don't publish, it is as good as it is in dustbin. If you make an attempt, of course, there are some guidelines where it should be published and all. It is beyond our purview. If you ask me personally, you have done a work with some effort. Intention, I will not question that intention. You have done some work. Let it be published. Make an attempt. Make an attempt to publish. Somebody who is doing similar or who want to do a similar study might be useful, because you are giving some missing truth in your article. As I told you again, it's a very digitalized world where your work, similarly, somebody is interested, multicentric nowadays. Who knows? As I told you earlier also, it acts as a passport. Believe me, trust me, I can give you personally so many examples where just with one publication during his postgraduate student, one of my friends is now in Switzerland as a scientist. I'll give you later that story. I will not go into that. So, two important reasons why we should do publication. One is altruism. As I told you, what is mean by altruism? You are contributing for science, and self-interest. What should be most important if you ask me? It should be both, amalgamation of both. You should have the self-interest also with you. Of course, everybody want to get recognized. You will be very happy if you get publication and if somebody is reading your article. Don't you so? We feel recognized. We crave that. It's a human being. Recognition, everybody wants recognition. One way of getting recognized yourself is if you do publication, you feel very happy. So make an attempt. So how now, as I told you, we are a poor writers, but there are some guidelines in articles, particularly for professionals. Here professional I mean is doctors. We have some proper structure, and many medical journals and dental journals have these guidelines, how we should start writing manuscript. The most important is IMRAD format. IMRAD means introduction, methodology, results, and discussions format. It's a very clear guidelines. Why we are supposed to follow in these guidelines only? There are two reasons. One, for us, how to organize our content. How we are organizing our content is very easy for us. Okay, in introduction, what you are going to write, in methodology, what you are going to write, in result section, what you are going to write, and in discussion part, you are going to write very clearly. So I will be very clear when I am writing what I am going to write away. But whereas for readers, he is very clearly looking for something. For postgraduate students, now your faculty will go and search articles and search for topics. Blake sir was telling it is not the way to send, but it invariably happens. So then where to go and search what? If you ask me personally, go and first read methodology section. Because for topic selection, feasibility of your study is most important. Don't get trapped in your introduction part. Don't get trapped with your title. Don't get trapped with abstract. Just go read methodology section. In methodology section, what you're going to find? You're going to find the feasibility. If you take up the study in these 3 years, whether I am able to complete this study or not. Because so MUHS is very particular. I'm going to give you so many examples later. It's very important. You will write a synopsis and you will send. Later you will come to know that the device, the technique is not available in Maharashtra or in India. It's very difficult later. You will be running behind to complete the dissertation work. And in between this running behind, you will compromise with your so many research methodology which we discussed now. So go read methodology, and definitely that is the best way for postgraduate students. What are the two advantages? I told you very clearly. Now in introduction, what you should write, how you should write. Two things are there. What I should find, what I should write in introduction. If it is already there, then what I am going to write again. So what? In literature, it is called what and so what. It should maintain our introduction when we write in a scientific article should have 4 criteria very clearly. We write in a very phases usually. What are those 4 criteria which that introduction part should meet in your manuscript? First and foremost is your scope of the journal. Journal will clearly tell in your website what is my scope, which I am going to look from author. So fulfill that scope by reading the author's guidelines. Then is most important is quality of your paper. Quality of your paper means what? How you are going to write your methodology section. And how your quality is very high or quality, whether article has a very high quality or not will be decided by your methodology section, which you are going to detailedly write down. And next is your results. What new results you found? Why I should feel that this article should be published? What is the new information which you are contributing for public health significance or clinical health significance? Two things, either it is public health or clinical. So your result should be very novel. And novel means it should be useful. And of course, if you read this introduction part, is it worth reading to continue? Whether I should continue to reading this, because nobody has the time now. They will just brush through search engines. I will come to that part later. So your title, your abstract and introduction really matters, because nobody will read completely the whole articles. So introduction is very important. It should always. Then coming to this, how I should write, what pattern I should follow, what are the tips I should follow. Funnel shape, you remember funnel? Introduction should follow this approach, general to specific. It will be dead opposite while write a discussion. Funnel shape. General, give general background. Justify the need for study. For that, what you should do, how you should write. There are again 3 phases. In introduction, we can follow it as in 3 phases. What is that? What is your territory which you are trying to establish? Means which territory you are going to start your work. So establish the territory. Why you are taking up this topic? What is being work done till now? What you are trying to find which is been missing, that is establish the mic. Means here, after going to giving the background information, this much of work is being done till now in this topic, in this area of interest, but I felt this is missing. You have to establish that link now. From one paragraph to next paragraph, you have to establish a link. You see, this much of work was done in this area of interest, but I felt this is missing. So now I am contributing to do this research with your aims and objectives. You are understanding this introduction part? This you are going to write in a synopsis also. It's like overlapping both synopsis and manuscript. So I am covering both at a time. So first tell what your area of interest, establish the territory, then what you found which is missing in your study, then how you are going to set your journey with your purpose of objectives and aims. Understood this introduction part writer? This is very important, your introduction part writing. This is general to specific. Usually IMRAD technique which we usually follow without any alarming approach. But apart from this, some other ways of introduction also is there. You want alternative approaches? There are 3 types. You establish a problem. Say for example, it's called an alarming approach of writing. Suddenly you are writing 90% of people are suffering from particular disease. Means you are in introduction only, you are telling the reader what you are trying to write. Means what you are trying to address in your introduction. It's called an alarming approach. Topic problem is established here. Then what you observe and what you are explaining will matter. These are the 3 phases which you are writing in introduction. So alarming approach it is called as. So this is how you should write an introduction in brief. But when we are writing an introduction for a manuscript, totally whole manuscript will be around 3,500 maximum. Again, varies from journal to journal. You have to see the guidelines. Around introduction, around 600 to 700 words, you should keep your introduction. You should again divide that. Introduction, how many words, methodology, how much words, results, how many words, and discussion, how much. Usually around 600 words, you can write. You should complete, keeping this in mind. So you are going to give this. But usually when you are doing this, we commit some mistakes. What are those? Unnecessary filling some background information just to fill or increase our references. We usually do sometimes. Those are not acceptable. Just already people know this. Again, don't repeat that. Don't make that. The moment then reading this introduction part, people will understand whether this is a genuine or not. This author. That will come in your article evaluation and critical evaluation should be taken in the afternoon session. Don't exaggerate yourself always what you found in your introduction only. Okay. And very clearly state your research question, research hypothesis, and what is your objective which you are trying to do. If you fail to write in introduction only what is a research question, what is your null hypothesis, then reader will never understand what you started. You just give some background information and came to a methodology section. No, you have to very clearly at the end tell what is that what you undertook, what is the gap existing, then what is your research question, and what is your aim, what is your objectives. That is how we should follow. That is how general to specific funnel shape introduction. Is it clear? Then you have moved to materials and methods. Methodology section. Methodology section is very important for validity of your paper. Validity means specifically what you are trying to tell, you should tell properly. That is the meaning of validity. In validity, you have two types: internal validity and external validity. In methodology section, internal validity is very important. Keep this in mind. So what do you mean by internal validity? Internal validity means your methodology, means who are your participant, what is your sample, what is your sample size, what is your sample methodology, how you determine the sample, why you choose these samples, what is your study design, why you choose the study design. Everything you are in detail mentioning properly. That is internally validity. Why you are telling? Because as I told you in science pillar methodology, one is validity. Because somebody want to do a study similarly, or you are establishing the credibility of you as a researcher because you are explicitly explaining the methods. You are very open book now. Your credibility will increase. So write properly internal validity, fulfill the internal validity. In journal club also you are going to see this. You are critically evaluating the article for this section, most important. Why? If internal validity is sound, then only we can do generalizability. That is called as external validity. Then only your conclusions will be accepted. If your methodology is not properly mentioned, properly detailed, explained, then definitely mark my word, it will not be generalized. Next is results. We wrote introduction, we wrote methodology section, we are now coming to result. Result is what? Simply you are going to present. You now just types of presenting data and all you have just read yesterday and today. Simply present your results which you obtained from corresponding methodology which you did. You did some methodology, you used the methodology and you got results, place that in tables and graphs. Okay. But here some most important things are there. When you should write tables, when you should use figures, and when you should use text. That is most important. So what is that? Because sometimes that journal only will give guidelines, whether you should explicitly write only tables or explicitly use the figures or explicitly use text. But common guidelines are what? This is the simple chart which you can see, where when you should use tables, when you should use figures, and when you should use text. You see, basically results is what? Your journal is very clearly telling that your whole study should be, your whole manuscript should limits of word is 3,500 words. But you have got so many information with you, you cannot compare everything. The best way of comparing and present to the people is with tables, graphs, and text. So what? The best tables, what? So many values are there with you now. You have to concise that in a small, just one table. So use the table. You have to show some trends. You have to show some pattern in changing pattern in COVID-19 sufferings from 2019 till now. You are showing some trends or pattern. What will happen in future? Use figures. Use figures that time, for example. No, you are very, there is no complicated here. Much don't have very complicated matter. Just with some text also you can explain. That time you write text. You're understanding when you should write tables. This is very important when you're writing synopsis or your manuscript also. It's very clear. And you are comparing some your old data with your newer data, your only pre-data with post data, or before and after. That time use tables. When original research articles. Sometimes figures are used to summarize your findings. Use that. You have only two tables. That time you don't want to use two table. Just use one text, right? In text. That is also acceptable. Specific presence or absence. Diabetes is present or diabetes absent. Your own, for example. Malaclusion is present or malaclusion is absent, for example. Use tables. Use tables properly. Or some events you want to show, or some particular sequence of visual examination you want to show. So that time you show figures. Okay, these are some you did some study. Apart from your objectives which you found some other results also. Secondary objectives we got. You got that results. Don't put that in tables. You put it in text. In result section, you write. Because introduction, you have mentioned some research hypotheses. In introduction, you have given some aims and objectives, and it should correlate only with your tables. Extra results you don't write in tables. Extra results which you got now, you found, you write that in text. You understanding this? Some guidelines are there with respect to the tables and all. Please ensure that they are self-explanatory. Probably this has been taught to you now how to write tables, graphs and all. This again, refer but don't repeat. What do you mean by this refer but don't repeat means? We will write in tables. It's self-explanatory table. Again, don't write the same in text results. You are writing a result section, no? You might have seen some articles. Again, don't repeat what is being explained there in self-explanatory, what's being displayed in tables. Don't write that. Give clear and explanatory informative titles. And most important, you should adhere to the guidelines of journal. Because if you don't adhere to the guidelines of the journal, they will outrightly reject. They will send back. So once it comes back, again, we will resend, but sometimes we will lose the credibility. So don't give that opportunity. You written introduction, you written the methodology section, you wrote the tables with tables display, diagram, table 1, 2, 3, 4, 5, depending upon the guidelines, then coming to discussion part, which is very important, most important. Apart from introduction, which will have some criteria background, again, most important section is your discussion. Discussion should start from your findings, keynote findings. Discussion is what? Your results which you have obtained. You showed that in result section. That is evidence. That is evidence of your study which you did, but that doesn't explain in itself. You have to now explain your discussion. You have to explain your discussion. Why? Because it answers the question which you have posed in introduction part. You have posed some questions, no? Research questions, null hypothesis. Now you are going to discuss those in your discussion part. Now in introduction, you wrote from general to specific. You start from specific to general now. Because you are now reasoning, you are generalizing, externality you are starting. Because your findings which you have found, you are expecting that to be a public health significance or clinical significance, but you should be explaining that why your result should be accepted. Why your message, which your keynote message should be accepted. Now you start from specific to general. Okay. So what are those? How we should write discussion? First, you will write about the most important findings of your study. The present study showed, the present study, in my present study, we found like this, like this. Then explain in each discussion, you are going to start with this. What? Methodology section, you have chosen particular target population. Or you have chosen from vulnerable population. You have chosen from specific population. Why you choose that population? They explain that. Now in discussion. And some results which you obtained, no? You start discussing with the similar findings which you obtained from other authors, as well as contradictory findings. The present study findings are similar to the study conducted by so and so et al. At the same time, present study have got some findings which is contrary to the findings of some other et al. Similar study. Now you should explain with deductive reasoning why in your study your finding is differ from the other study. You should explain that. You're understanding this? This is a little bit tricky, not much difficult. You have to understand the trick. If you understand the trick, you will write a discussion. The present study finding found that Angel's class 1 marker present in my study treating this technique is effective. This finding is similar to the study conducted by another et al. You found that. But the same methodology using that, you found that there is a contradictory finding also. It is not effective, for example. Now you are explaining here, probably the age group selected in that study was 10 to 15. Probably mine was not effective. Probably my age group is 20 age group. That is why there is a difference in my finding and that finding. You are understanding this? Very vaguely, I am giving example to make you understand. Like you are explaining in discussion each findings. Similarly, why I got? Why? Because of the methodology same. But contrary why you got? Probably age factor or gender matter or some variable which you have tested might be contributing for different result. You have to write that in discussion. Like that, you are explaining each and every section of methodology in discussion part. Now, what are some common mistakes which we do? if we don't organize properly ourselves when we start writing discussion, means what? You should have an appropriate literature research with you. Pertaining to your study, you should have collect ample evidence, ample citations with you, so that you will read enough articles. You will have a fair idea now how what is my study and how I'm going to use the different articles, similar studies, which has been conducted. So organize yourself. And again, don't just write the results which you have obtained in discussion, but don't write that. And don't write something which you have not done only. Somebody I might have done in discussion part. Some similar articles might have used that discussion part, but you have not done that. No, don't use that as your discussion part. Chronologically orderly place from key findings to very less significant findings. Chronologically you arrange in your discussion part. Very key finding which you got, your aim, objective. Later on, some very less significant findings you will get. Keep that last. Major findings, minor findings. First write major findings, then go for minor findings. Okay. If you don't have results which you have found, don't write that in conclusion part. Because you are not done anything, but you are writing something in conclusion part. Don't write that. Don't do that. That's a mistake. Sometimes people send back that. Okay. And most important, as I told you repeatedly, you are explaining with logical arguments. Deductive reasoning, inductive reasoning is most important in discussion. If you have this little bit in mind, then it's very easy. You write an introduction, you written methodology section, you wrote results, you wrote discussion. No, this is not the end. Now the starts manuscript. Now the manuscript starts. What is that? Apart from this common pitfalls which I addressed, conclusion you will write. Conclusion is what? Brief summary of the results and discussion. Okay. Always see that when you're writing this conclusion, no, keep your reader who is going to read your article in mind. Okay. Because you have accomplished some work, keeping the readers in mind. Should have some, because whenever we write the titles and whenever you write the abstract, now next thing which will brush is conclusion. Will go and see the conclusions of an article. So provide some key message to that reader. And most important, some future perspectives might be required in your write-up. Further studies have to be conducted with larger sample size or with this changing method. You have to give that recommendation. Conclusion, in conclusion. Now comes citations. This, if you see here, I didn't talk anything about title and abstract. I started with introduction and now I am coming to citations. Why I will tell you. Citations, why you should do. References, why you should do. When you start a topic, MHS expects minimum 5 key articles. So when you select a key articles, keep this in mind. You have a 5 sound key articles, master key articles with you. You will select a topic, but you don't have a references only with you. Then it's very difficult during your synopsis timing. You will be running this. So select the topic, see that appropriate key master articles are there for your citations. Why you should do citations in manuscript? As I told you, we are cumulative knowledge. You are accumulating knowledge, no? How? With past knowledge. Because somebody cited, so you use that. So it gave the contribution. Okay. And most important, you are allowing yourself critically. Yeah, you are using one citation for your methodology section, which you use or introduction. If I want to test that, I will go to that citation and I will see that article, whether it is right or wrong, which you have used. Your credibility will be tested here. For these things, keeping in mind, you have to do citation. On your own, you cannot write anything in introduction and discussion. Only logically you will explain when you are having contradiction of your, but in introduction part and in discussion part, you have to citations is mandatory. Citations are very much important because you are giving yourself to critically evaluate and you are establishing your credibility, and the reader or any other person who is seeing that will be understanding this person has gone through the review of literature properly. Otherwise, it will not be useful. Because of these citations only, your quality of your article will be established. What are different types of, I will add this here only, it is not part of here. How you have to do your citations? There are 2 types in scientific article. One is Van Coastal and one is Arbor. Vancouver style and Harvard style, let me explain first what is that. Vancouver style is introduction, you have written one paragraph and you have given some 1 or 2 articles citations. For example, WHO says according to 2021, COVID-19 is 40% of people are immunized. For example, you have taken this as a sentence or you have reframed this. That you have taken from WHO site, for example. So you will make it as a superscription 1. Okay. Next, you will further move on and you will write another one. You have written something. Citation will be second. So 1, 2, 3, like that. You will start writing from introduction till discussion. Some 25, 30 articles you have collected and cited. So in Vancouver style, you are going to order that in 1, 2, 3. First appearance in first where it is appeared will be first article, irrespective of whatever the information has been. That will be first article and that will be first reference. Like that, it will be corresponding. That type of reference which you are using is called as Vancouver style of referencing. How to do Vancouver? You understood what is Vancouver? You will be required. So Vancouver style of referencing, how to write? If you are taking a reference from an article, if you see this which I have displayed, first there will be author name. Usually 6 author is the maximum author which you can write. Later on, if there are more than 6 authors, you will write et al. Keep this in mind. So author name will be done, then topic name. Here, for example, a tale of 2 citations. Nature. Nature is the journal name. So first is author name. If you are having 5 authors, write all 5. If it is more than 6 authors, then write first corresponding author or first author, then do et al. Then the topic name. Then you are going to read the journal name. Then you are going to read the year of publication. Then volume, issue, and page number. Now, if you see here, there is one mistake here. 397 to 399 page number. Many of people now also publish is wrong. Many journals are doing that. Currently, what it says, 397 to 399 is page number. When we are writing now, you people follow at least 397 to 399. You should not write 397 to 9. Only 9 you should write. 397 to 390. It's understood. If it becomes 400, then only you should write 397 to 400 or 401. If it is the same 1 to 10, 391 to 396, then don't write 391 to 396. Just write 391-6. These are common errors which we do, and journal sometimes ignore journal. But as a journal critical evaluation, I will make it as a mark. It should not be accepted for publication. If you ask me, so I will not be called and I will not do also. That is secondary. Anyhow. So next is book. If you take book, take first the author name. Again, same. The title of the textbook, then which edition, which publisher, mention that properly. Okay. Next is if you are, sometimes nowadays you are taking references from online much. In our time it was not there, now it is much. So okay, fine, it is accepted now. Accepted online, you should write. 13th references, your 13th references you accept from online. Okay. So you are going to that toolbar, there is one HTTP. You have to copy that only, keep it somewhere aside and paste like this. First is author name, then what is the topic which you have taken, which you have chosen. Then you are going to write this. You copied this no HTTP available from, because I want to know as a reviewer, I want to see this. I will just take that and I will see cross-verify that. So HTTP this website address. Then when, because sometimes the articles might be removed also. Accessed on which date you write, you mention that. Why all these things are required in journal club or critical evaluation? All these things should be seen. Journal club when you are doing, no, before that 15 days, you are supposed to do these things. Whether that author, it might be, don't think that all published articles are foolproof. So many times settings se bhi ho jata hai. Okay. So see that references are being properly cited or not. In a true sense, if you want to do evaluation, this is the way. Next is Harvard style. Harvard style is what? It is dead opposite of Vancouver. Here first we will write 1, 2, 3, 4. It's not here, it's not like that. Alphabetically. First author is, say for example, Zakir. Alphabetical, you have to write Z last only. In referencing in Vankov style, Zakir et al. Was first reference. So here it becomes first, but in Harvard style it will be last. You got this? Alphabetically A, B, C, D only. So when to write this or when to write? In your MHS, you are supposed to follow Vankov style. When you are sending for publication, go to the author guidelines, see which type of referencing they are seeing. Follow that. They will be giving you examples, whether you should use Vancouver, whether you should do Harvard. Follow that and write the manuscript. Okay, but remaining all are same. This is how it should be done. So you are done introduction, you are done with methodology, you are done with results, you are done with the discussion, and in between I missed out something, that is you are supposed to do acknowledgement. Acknowledge your author, your batch statistician, or you have done some study with some in vitro, some with other college. Acknowledge. It's a properly and conflict of interest. Whether you have any conflict, say for example, you have done a sponsor. Whether sponsor, there is a conflict of interest with your findings and with sponsor. You mention very clearly. Sometimes we'll write nil, or if it is there, mention that. Author guidelines will be mentioning that you have to write the conflict of interest references after writing that. Now, what are the other, why we should write these citations? As I was repeatedly telling this, critically analysis, for the critically analysis, for giving the background information of the reader, and your self-esteem. If somebody is doing the given the citation, we feel very happy. Mail will come. Your article which you have published has been cited by some author. We'll feel very happy. So cite that. You citations. But there are some bias in the citation. What are those? I will tell you later. Before doing all these things, this is one part which you completed, major. Verify. Keep on verifying. What? Frequently we will go for incomplete and inaccurate problems which you are not mentioned in your journal, article which you have written. Again, go for that. It is not reviewers, editor's job to see whether you have done any mistakes or not. Verify that again. Go. How after exam writing we will just go rewrite that. Because current literature somewhere I have, so this is very latest information. Medical journals. I told no, we are not a good writer. Medical journals, dental journals, errors which this is one study, 2019 probably. 34 to 67% of references are having errors. And all are published. You can understand now how the publication happens. So don't always think publication means that is foolproof. Or this type of journal, then will come in evidence, levels of evidence, that is different purview here, I will not go that. But article, you should be very honest. So read that, only citations which you have read. Just reading abstract and giving citations. Don't do all those things. Read complete article. Because after that only you are doing citation, no? Read completely the abstract. No only abstract. Complete article. Only those things only should be used. Otherwise, don't use. This is what I was specifically wanted to tell this for you people. There are different types of citations. Spurious citations. Citations was not required only. Just we gave citation because we didn't have much references. We wanted to only 5-10 references are there at the end. But no, editor is not accepting. So we will add up on now, review some citations now. I have to make it 20. Example 10 will become 100. Hopefully, we will not do this. Don't do that with citations. Don't do this with citations also. Okay? Don't do that. If it is required, if it is genuine, that only you add. Just to build the credibility of giving some big people's references, don't do that. Spurious, it is called in research experimental spurious association. Dependent variable and independent variable, I don't know whether it is being covered or not. Spurious association means there is no association between effect and outcome. But still we will take there is association. No, that type of association is called as spurious association. Here it is called as spurious citation. Don't do that. You have 10 articles, keep it that only. Because you are doing something new. Neologism. Keep it that. It might be very innovative. Keep it 10-12 only. Other one is biased. मेरा friend है, उसका नाम पहले डालता हूँ, उसका वर्क पहले डालता हूँ citation में. Don't do all this. As a beginner, we should not do all this. We also should not. I don't do anyhow. So bias citations means just making people happy. Friends ka articles se select karke dalne ka, or I know that person's, because to increase the impact factor, I'm not covering all those things. Yeah, just to increase the H factor, size factors. No, all those things. No, don't do that. Self citations. Just I have done. I'm not telling self citation always wrong. No, if it is very related work you have done already one. Again, you are carrying forward that another project, and your article is already publication is done. Okay, do that self citation. If it is really genuine and all, go ahead, no problem. But it should be very minimal. This is most important. Excluding. It's very good article, but it is not similar to your finding. It's contradictory. No, this article I will not write. I will not take as a citation. Why give that? Because why it is very important to cite that? Because I told you, methodology, somebody want to do that, no? Why your study is giving different study result, and why that study gave different result? I will check again. So give that. So these are about citations. Two important things we should keep in mind doing citations or completing your work. Two questions you should ask to mitigate all these problems. Have I provided the references that I will make this paper as useful as possible? Because the whole purpose is altruism. Altruism is most important. So whether I have answered all these questions, ask yourself. Just don't in hurry, just try to, madam, your guide will tell, upload, yes, don't do that. Take your time, properly read, answer this question first. And if the reader looks up your reference, will it be time worth spending? Because as an evaluation, we should always go for methodology section and reference section, which nobody does according to me. As I told you on good references, 70% of references are wrong. You can imagine. And whole publication is based on references. And whole science is based on publication, that is knowledge. You see how no dots are joined here. Your science is based on cumulative knowledge. And the citation is most important. And references are wrong at up to 70%. You see where we are? No. We should address this. We have completed this. Now coming to abstract and title. Your MHS says first write title. But manuscript writing tells you should write last. This is one of the most trickiest problematic. You don't know what you have done, but you have to write now title. Your synopsis, and synopsis will be sent back because of wrong titles. Many times, particularly MHS is very strict with this. They'll send that just because why title is not. I will tell you what type of title and all is to be written, what is title and all. But here title should be last written. But contrary to your synopsis, you'll be writing first title. It's a very unfortunate scenario. System expects that. Nevertheless, when you are writing manuscript, see that you are going to write abstract and title last. If you ask first which one, sir, write title last. First write abstract. What is abstract? Full form. Anybody? Anybody full form of abstract? Unmute and tell. Abstract means AB, absolutely. Okay. Structured. Absolutely structured. Next is act. Acting upon means thoroughly acting on your tables and graphs presentation. That is a full form of abstract. And how to write abstract, sir? Don't write abstract first. Again, that is another one. तुम्हारा मैडम, तुम्हारा सर, तुम्हारा गाइड बोलेंगे अभी कॉन्फ्रेंस आ रहा है, abstract लिख लो. अरे स्टडी नहीं हुआ, abstract भेजने का पहले. Next week you have to send abstract. Send me abstract. I will write. I will read. No. For that you should first prepare a short project. You should know, then write abstract first. How to write abstract? There is a structured way. Usually in medical journals, so 75%. After since 25 years, there are different types of abstract we used to write. Unstructured, then simple structure. Now it's only a structured abstract. Structured abstract means what? A proper structure is there, like IMRAD approach. Here also background information will give, methodology will give, results you will write, and conclusion you will write with keywords. So it should be very structured form of writing abstract. Background properly, and abstract should be how many? Usually, if you ask me, journal base 150 200 words abstract. What should be there, sir, in abstract? Next question. Whatever your content of the body, that should be minimized here in abstract. So for that, then, am I right now? The study should have been completed. But here, with your study completing, we have written abstract and sent. Your understanding abstract should be written from taking from body, but here content. Yes, it's accepted. Sometimes in conferences and is required, you are right. But hypothetically, that's how you are going to write abstract that time based on your literature research. Based on your literature research. Titles. It is in English idiom, it is there, no? Don't judge me by seeing the page, something is there. I am a very poor English person, so it's huh?
Don't judge a book by its cover.
Don't judge a book by seeing cover. We always judge a person by seeing his appearance. No. Inside is most important. Outside is not important. Sometimes it is important. So presentation is very matters. But in coming to title here, there are some guidelines for us. There are some guidelines which is very clearly laid down in scientific articles. Always after writing abstract only, this is the last which you are going to do, but reader first will see this one. You see, title and abstract are very important. This now current era is digitalized era. Ravi was telling now, search engines, your keywords, all these things will be your main keywords will be there in your titles and abstract only. Otherwise, if you miss writing a very proper keywords in titles, you might be having a very good article in your hand, but it might not be selected. And it will not be cited, it will not be read. Your study was very good, but we failed to write a proper title and abstract. We failed to write a proper title and abstract. That is why search engine didn't accept our citations. So we failed to cite. It's not that only citations. Why? Because we are very poor in writing our titles and abstract. So title is very important, and a reader first will see title. But as an author, you should write last. As an author, you should write last, but as a reader, first I will see title. So what I should do? What is the importance I told? How it should be? It should be accurate. Title should be very accurate. Title should be simple. Title should be appropriate. Title should be specific. Title should be interesting. Title should be captivating. Because these things only make the reader encourage. If title is very attractive, but it doesn't have dependent and independent variable. In your title, there should be proper dependent variable, proper independent variable, proper study design setting. Study design, study setting is subheadings. Main theme of your study is very clearly dependent variable and independent variable. Sometimes your journal accept only, then after giving colon, you should write the study design, study setting. But I beg to disagree with your breaks are told it should be very lengthy, explicitly. No, it should be very adequate. Maximum allowed is many journals, it is up to 15 words. 15 words, not much. So what are the different types of titles in scientific article which we can write or which we can use? One type is called as descriptive, another type is called as declarative, another type is called as interrogative type of titles. Which one we should use, sir, first? Descriptive title should be the mandatory for all of us if you are doing a original research. If your study is a original research, you should always use descriptive title. What do you mean by descriptive title? The main content theme of your manuscript article should be there in a title without giving results, without displaying results. For example, estimation of periodontal status among type 2 diabetes. It's a descriptive. What? Here there is a dependent variable, there is an independent variable. Independent. Now, can anybody tell here estimation of periodontal status among type 2 diabetic patients? What is dependent variable and what is independent variable? Which one is independent variable? Here in this title which I gave, estimation of type 2 diabetes among Estimation of productile status among type 2 diabetes. In this title which I am giving, which is dependent variable, which is independent variable? One. Yeah. Yes, sir. So here diabetes, you are trying to see the effect of this productile status because of the diabetes. What is the effect on? So, sir, sorry, diabetes is independent and it affect on productile status. So here, like that. Now, descriptive. You are not telling the outcome, results. What type of titles are descriptive type? Now, what is declarative? Declarative is you are directly giving the results. The curiosity is gone among results. You have to create a curiosity by not giving results. That you are going to do in descriptive, original research. But in declarative, for example, 30 days diet plan, make the person, the title says 30 days diet plan estimation on the BMI effect on. Here already you are telling 30 days effect on BMI. Everything is there. What I did? I did a 30-day diet. What is the effect? BMI on BMI or on appearance. That will not make the person very curious. They might skip this and it is not accepted. In journal, according to JMHIR article guidelines, that type of article will not be accepted, should not be accepted. Now don't ask this is accepted. You evaluate critically that in your journal. Next is what? Interrogative. Interrogative, usually we use this type of research by asking questions. Usually in review articles. When you are writing review articles, use interrogative types of titles. Particularly when you are writing a review. Wow. Usually we do original research articles, so use descriptive. Understood these three types of, apart from this, some subheadings are there. Simple titles and compound titles. Simple titles and compound titles means you are running now, after that you will be asked about running title. Description for running title. Running title is again taking a title with 30 to 40 phrases. From title you are going to take the 30 to 40. Say for example, diabetes productile status, just running title will be diabetes and productile status. Running title will be diabetes and productile status. Your estimation of type 2, estimation of productile status among type 2 diabetes, you will not write like that. Running title will be just 40, is 10, 20, axiom is 40. Running title will be what? Diabetes and productile status. Diabetes and productile status. Again, you have to specify type 2 diabetes or type 1 diabetes. Like that. Okay. Yeah, I have addressed this spiced. One more thing, don't use any acronyms in title, except if it is been very well familiar, then only it is allowed using acronyms. Otherwise, don't use acronyms. Most important, don't use question marks. Don't use question marks. That is interrogative, as I told. Don't use acronyms. Until unless it is very known acronym like laser, HIV. It is known. That is acceptable. Otherwise, generally, it should be avoided if it is possible. This is most important. We always tell keyword. Then how to write keywords? Why keyword is very important? As I told you, as a research engines, title and keyword is very important because sometimes not properly written content of body, proper title will be cited. But well written manuscript, but with poor title might be missed out and might missing of the citations. So keywords is very important. So what should be the keywords? Usually 3 to 5 are the keywords. You will see 3,500, 3,000 words. Per 500 words, select one keyword. And that keyword should be in your body. You are writing manuscript for 3,000 words. Your upper limit allowed is 4 to 5. Again, varies. If you ask me, around 4. So 500 words, one phrase. There should be one keyword inserted in that. Don't repeat again and again. There should be one keyword because that keyword will be reflected in your title. Now, how to search this keyword? Sir, how I have written everything. Next question is how I should select my keyword? Simple and best way is now we are now in Google Scholar or SEM Rush is another one site where you can choose your keywords. How I should choose my keywords? It is a SEM Rush. Okay, that is a site. So you go and type on keyword. Keywords, there are three guidelines for writing keywords. First is, you see, we have done some study and we also want to do something very new, innovative. It's called as neologism. Neologism. Neologism means something new phrase. You are Shashi Tharoor, you remember Shashi Tharoor, then you will remember keyword. He always comes up with some new words. You also should come up with one new word. But this is very difficult. Ask your scholars or your guides to help out with it, because they will be knowing better. Because the keyword, because same keywords, your article might be missed out. So many studies, 1,000 articles might be there, but your article should be displayed, no, in your scholars search engine. So come up with a new phrase, neologism. How many? One or two. Next is high volume citations. How many high volume citations? How I should know which is the high volume which has been again and again cited? Go for this Google Scholar or this SCM Rush and check this. Minimum at least 1,000 publications should have happened with that keyword. The moment you write a keyword, some 1,000 articles, if it goes, take that as your keyword. First is new phrase. One is Shashi Tharoor. Next is this 1,000 publications. Over no, 3 to 4 key articles. Keywords. Use this, that will be your keywords. And most important, keywords here again, articles do wrong. Always arrange the keywords in alphabetical order. Here is first, then D, diabetes. Then malocclusion M. First malocclusion, then diabetes. No, it should be chronological, alphabetical order. Keep this in mind. Over, probably manuscript is completed. Now next question, which journal, sir? Which journal, sir, is very difficult to ask, difficult to answer, but some things you should keep this in mind. These are the things. Scope of journal, whether it is in line with your study which you have done. What is the impact factor? I'm not going to, because it's beyond just now explaining impact factor. Whether your audience which you are trying to target and that journal which is trying to address, whether they are matching. Okay. And is it worth to publish? You should keep this in mind. Then sometimes consequences, what will happen? That will not go into your details. These are some, which journal you should choose. Basically, that depend upon type of work which you have done, quality of work which you have done, and then choose an appropriate journal. Usually, if you ask me, you search, go for some PubMed index, Index Copernicus, some highly valued journals which will be cited. Don't go for some predatory journals which is easily acceptable. Don't go for this things. It cannot be valid also for your promotion, careers, increments, and all. High impact factors journals are only considered. Again, there are in journals, there are different things, category 1, category 2, category 3 journals and articles that we'll be seeing sometimes in future. Now it will be difficult for you to understand. Now coming to fag end, if you are rejected, if you are sent now, your paper is rejected. Okay. Now probably don't, you will rejected, and if your author has not given any suggestions, means don't worry, it's not your mistake. It might be biased. Okay, it may be biased, just he might have, they might have. Right. So again, it is, if you feel that before sending for journal, complete manuscript, go impartial review with your colleague, with your peer review before uploading. See what corrections, what evaluation. They might be a better person to give you some inputs. Your guide, your co-guide, your faculty members, or your colleagues. Let them go through that, and then upload the manuscript. Again and again, if it is rejecting, then rule of 3 use. 3 journal. Usually, ethically, once you send an upload, you are not supposed to. That is one guideline. According to GCP guideline, you are not supposed to send for a parallel in another publication. But again and again, if it is happening, follow the 3 journal rule. You can send. So I would like to complete this session. Don't think it is very impossible to publish. In this impossible only, there is a possibility. Okay. So all the best. If people have done research and if people have done publication also. Now, critical evaluation of article will happen in afternoon. You be prepared for it. I hope you people have all got the article with you, which has been sent in morning. Go through that article. Now there will be lunch break. We have lunch break, and again we will join by 2 o'clock. Okay, thank you all.
Good afternoon, one and all. It's my honor and privilege to welcome our guest speaker, Dr. Prashant VK, who has done his bachelor's in dental surgery and master's in dental surgery from KLE Institute of Dental Sciences, Belgaum. He is currently a professor in Department of Public Health Dentistry, ACPM Dental College, Dhule, and has an academic experience of more than 14 years. He is also Executive Committee member, Indian Association of Public Health Dentistry. He is a part of peer-reviewed team in national and international journals and has got more than 50 publications under his name. On behalf of Shodha committee, we welcome you, sir, and we hand over the dais to you. Thank you, sir.
We welcome back.
Thank you very much.
Yeah, Dr. Ravi, Dr. Prashant, this session is handed over to you. Please start.
Yes. Ravi? Okay.
Yes. So how do we go about now? Shall I start the presentation and then we will break for group activity in between?
Yes.
Yes. Yes.
Okay.
I think article is already distributed.
Yes. Article is distributed. I hope every participant has the article. If you are not having the article, maybe I can put the link in the chat box.
We have distributed the article. We have sent to everyone.
Okay. And you can also download the consort statement which has been sent. KB sir, I have sent the consort statement to you.
Yeah. I will just share with the participants now.
Okay, I'll require in some time, sir.
Yes.
Okay, so I'll share my presentation and start with the presentation there. Okay, so I have a small kind of philosophical introduction to this. This is Socrates. You might know him as a Greek philosopher, very famous philosopher. And once when this philosopher was, taking rest, somebody, an acquaintance actually, he came, ran up to him and very excitedly asked us, Socrates, do you know, I just heard something about one of your students. Shall I tell that to you? So Socrates said, just take a moment, just wait for a moment. You can tell about my student to me, no problem. But there is a small test. You will have to take a small test. A small little test, and then we will go ahead with what you want to say. Then that acquaintance said, okay, no problem. What is your small little test? He said it's a test of 3. First, I will ask you the first question in that test of 3. First question is, are you really sure about what you are telling about my student to me? Is it true? Have you seen it yourself about my student? See, at this stage, Socrates hadn't even, got to know what was the truth about, but he just asked him, whatever you are telling about my student, is it true? Suddenly, this acquaintance who wanted to complain said, no, actually, I haven't seen or heard seen myself, but I have heard this from a second person. Then Socrates said, no problem. You might have heard from a second person. Let me ask my second question to you. Whatever information that you are telling about my student, is it something good about my student? Then that acquaintance says, no. On the contrary, actually, I wanted to tell something slightly poor about that person. Socrates said, okay, no problem. I will ask you my third question. Whatever you are going to tell about my student, if I tell that to him, will it be useful for him? for his improvement. Then this acquaintance said, I'm not sure. So then Socrates told him back, see, what you are about to tell me about my student, you're not even sure whether it is true. You're not even sure whether, it is useful to the person whom we are telling. And you are not, means you are not even telling anything good about that person. So if that is so, then what is the point in you telling me about this? So I hope that small story gives an idea about how a researcher conveys an information about anything to you. You are a consumer of research, as I told you in the previous lecture. And when an article is presented to you, the author is that acquaintance. And when that author is presenting you something, you should always take it with a pinch of salt. You should ask 3 important questions, similar to how Socrates asked. Is it new? Is it true? Is it important? And if the answer is yes, then only read the article, or then only believe that article, or implement the results of that article in your clinical practice. So the 3 tests for critical evaluation. Is it new? Is it true? Is it important? So when you are asking a question, is it true? Basically, it means whether the methodology done was proper or not, whether there were any biases in that particular methodology. So that is it true? That we call it as internal validity. Whether the study is done consistently, whether the objectives are written properly, whether the methodology is appropriate for that objective, whether the results are as per the methodology, whether the statistical analysis is same as what is mentioned in the methods, whether the conclusions are matching the objectives. So when we try to check each of these things, we call it as internal validity, internal consistency. That means there should be some proper alignment between introduction, methods, results, and discussion and conclusion. So if there is a proper alignment, if there is a coherence, then we say it has internal validity. Then we have another aspect called as external validity. See, Socrates asked a question, whatever you are telling, is it true and is it good? And then he asked a question, whether it is useful. Something can be very good and very true, but that may not be useful in my clinical practice or your clinical practice. Then what is the point in, reading that particular article? If that is of no use to you in your clinical practice, if that is not applicable to you, if there is a wonderful agent, like a wonderful vaccine, they have developed for COVID, and it is available only in America, and it costs some $50,000. I mean, what's the point in knowing about that particular vaccine? It's anyway not useful to us. So whenever we read an article, we should ask 3 questions. Is it new? Is the information that is being given really new? Or has this already been presented to us? Or is the information having something new in the results? So is this a new treatment? Something new should be there in the article, basically in such a way that we change our practice with this new information. We add this new information to our day-to-day clinical practice. So is it new? Is it true? That means, is the study done as per the proper methodology of a study? Is the design correct? Are the methods correct? Are there any biases that will misinterpret our results? So is it true? That is the second question. The third and the most important, is it important to me as a dentist? So if any article can pass these 3 tests, then that article is very good article for you to read and to implement that in your practice. If the answer is no, then you have to reconsider whether this article is anyway useful for you or not. So whether you should take this up for journal club or not, whether you should adopt this, whatever is recommended in this article in your day-to-day clinical practice or not. So what is critical evaluation then? Critical evaluation is nothing but getting answers to these 3 questions. Is it new? Is it true? Is it important? Any article when you read. If the answer is yes to all these three, of course, answer will never be a simple, straightforward yes or no. It will always be, an explanation. Like it is new, yeah, it is new in this way or that way. It is true in this way or it is important in this way. So there will be an explanation to that. But once the answer is approximately yes for all these three questions, then you say that article is good. The process of knowing whether that article has these three characteristics will be your process of critical evaluation. So this is the objective for my presentation today. We will try to have some interactive discussion and also a group work. So each one of us should be able to appreciate the importance of critical evaluation of a piece of research. Now, what do I mean when I say piece of research? Basically, it can be, an article which you might be reading. It might be a manuscript which has not still been published. It is just some article that has come that your student has prepared or you have prepared, and it is in the manuscript stage. It is not still published. Or it might be a dissertation. It might be a poster or a paper that somebody is presenting to you in your conference or that you are planning to present. So any piece of research has to go through this process of critical evaluation. So you should be able to appreciate the importance of this particular critical evaluation in using any piece of research. So what is critical evaluation? Critical evaluation is not criticizing. Critical evaluation is not fault finding of an article. Okay, so that we must always remember. Every research has one or the other deficiencies. Either there may be a funding problem, there may be a problem of the recruitment of patients, there may be some biases which cannot be removed. So that does not mean if some study has some defect, that study has to be entirely thrown away. So our objective is not fault finding. Our objective is critical evaluation. So it is not criticizing. Then what do we mean when we say critical evaluation? Is it finding only negative points? No, definitely not. You should always see what is good in a particular article so that ultimately you have to answer that question whether it is useful. So it is evaluating. It is evaluating the usefulness of anything, whether it is really useful for you in your clinical practice. The results of this study, are they useful? Are they applicable? So that is what is critical evaluation. So for this particular critical evaluation exercise, we will take up this particular article which has been sent to you. It's a simple article. I selected this article because it is just 8 pages and also it is a randomized control trial. So considering that it's a very standard study design for comparing two strategies or two treatment strategies. So I selected this article. So by the end of this presentation, you should also be able to identify aspects of critical evaluation by reading this particular sample article. Okay, so I already talked about this in my previous presentation. The 3 C's of health professionals' role in research. One is that you will conduct research. Other is you will convey or communicate your research. And ultimately, you are the consumer or end user of this research. You are the care provider. So you have to use the current best evidence available in literature. That means you should be able to search the literature well. You should also be able to use that literature well. So this particular critical evaluation exercise will help you in fulfilling the consumer's role, the most important role of your health profession. So what is a journal club? Why do we actually have these journal clubs? Again, coming back to the same 3 questions of is it new, is it true, is it important? When you find an article that has something new, something true, and something important, you will want to convey that information to others. So it is literally impossible for everyone to read every article. So what would be good is that we divide our subject area into maybe few journals, and every student or every teacher, every faculty or every practitioner goes through some part of that particular journal, maybe few articles, and tries to find the ones which are good and ones which are useful, ones which are true. And then you have a group of individuals where you meet and then you critically evaluate that particular article and decide whether we should now use that particular article in our clinical practice. So a journal club is a process where a group of individuals who meet regularly. So this is not just, taking up one article and leaving it. Regularly, you are meeting and you are critically evaluating recent journal articles in the scientific literature. So we do that to find out what is new, what is true, what is important in our scientific literature. So what is the objective of a journal club? Acquiring and disseminating new information, developing critical reading skills, analyzing for standard methods of conducting and reporting research, communicating skills or communication skills will also improve, especially written communication. Once you understand how to read an article, you will be able to communicate your article better, your own research better. And to encourage peer-to-peer learning. So somebody has found out something new, so he will tell that to you, and you have found out something new, you will tell that to the other person. So it will help in learning from each other. So these are the objectives of having a journal club. Most importantly, evidence-based practice. You ultimately want to use this in your day-to-day practice. A lot of times, once at the end of journal club, what happens? Some new information gets incorporated into your SOP, standard operating procedure of your department, or maybe it might be taken up in your association and you might include it as a standard procedure or a practice guideline in your association as recommended by your association. So that will become an evidence-based practice. So you are gathering evidence from the literature and using it in your clinical practice. So whenever we critically appraise article, we need to see each of these components of that article: title, abstract, introduction, methods, results, discussion, summary, acknowledgement, references, figures and tables. So at each of this, you should apply your scientific mind and see whether these are appropriate or not. There are specific guidelines for each of these sections. And there are ways to know whether each of this section is done well or not. So you can take this item by item, like title, abstract, introduction, methods, results, one by one, and you can comment on how well it has been written. But more importantly, especially the methods and the results, how well it has been done and how useful are the results. So you have to concentrate on these two as well. So this is the basic structure of a paper. You can use your chat box now. I'm going to stop my presentation. This is the usual structure of a paper: introduction, methods, results, and discussion. So now take a moment to think about introduction. What should be there in an introduction? In a nutshell, you have to maybe tell 3 keywords or 3 key points that should be a part of an introduction. So I'm only asking about introduction now. So let me stop my presentation as of now and get back to the chat box. Okay, so what should be there in an introduction? So I need to get from at least 10 participants. Okay, problem statement, background of the study, purpose of the study, need for the study, aim, need, okay, current trends, okay, importance of that particular study. Yes. Why, what is the importance of that particular objective or aim that you are trying to study? Objective. Yes, you have, some of you have used the term aim objective. Some of you have used the term objective. Some of you have written aim only. Some of you have written purpose. These are all same. These are all used interchangeably. Gist of the study, Dr. Prachi has mentioned. Gist of the study we would expect in the abstract, not so much in the introduction. Introduction would be concentrating mostly on what all has been listed as of now. Dr. Jadhav talks as research gap. Yes, definitely. You have to talk about what is the research gap. What is not known right now about this particular area. So that will give an importance of course, as Dr. Pritesh says. Yes, that will give the importance of this particular topic. Again, here we have Dr. Ravindra mentioning hypothesis. Yes, hypothesis has to be mentioned if possible. Otherwise, at least aim or at least objective or at least purpose. So these are almost used interchangeably since article has a very less space. So we cannot expect the author to put all of these things. From known to unknown, Kamal ma'am has mentioned here. Yes, introduction should be written in such a way, we call it as a funnel approach. First, you should say what is known about this topic and what is not known about this topic, or as mentioned by Dr. Jadhav, as a research gap. And then maybe justify how your study will bridge that gap. So that will also bring us to, as Dr. Bipin has mentioned here, clinical implication. So if you can justify why you are doing this study, then you are also justifying the clinical implication of that particular study. General to specific is almost similar to what Kamal ma'am has mentioned. Dr. Shirish has mentioned general to specific. Yes, we should tell in general about that particular problem. And then, but we shouldn't deal too much in general about that problem, because our readers are mostly from the scientific area. So we can directly go to more specificities. But yes, of course, we should give the background and we should go from general to specific. Okay, thank you so much for that very nice reply. I don't require to do the presentation related to introduction actually. You have told me all the points, but yet I will just quickly summarize what I had put in my presentation. I'll share my screen again, and I hope I am audible. Okay, so what should be there in an introduction? As Bradford Hill says, introduction should have a proper justification as to why did you do that particular study. So if you can explain why did you do that study convincingly to the reader, then you have written the introduction properly, or the author has written the introduction properly. And what should be there in the methods? Of course, I don't have time for interaction for each of these 4 points. So I'm skipping that. I'm directly giving the answer. I'll just give a moment for you to think. What should be there in the methods?
Sorry to that slides are not big enough. Yeah, now it's fine.
Okay.
Yeah.
Yes, sir.
Yeah. Yes. Okay.
So what should be there in the methods? Why should the methods be written? Just take a moment to think of why should the author mention his methods. Why should anybody mention the methods in detail? What is the purpose? So I'm not going to go to the chat box now, since I want to go
feasibility
quickly.
Of the study.
Feasibility of the study. Okay, method should be written in such a way that we should know feasibility of the study. Yes, I agree in some way, but I feel methods should be written in such a way that it should be replicable. Like if somebody has given their method, of course that replicability will also give you feasibility, whether that is feasible to be used in our settings or not. But before knowing feasibility, we should know what their methods are clearly. can I use his method in my setting? Like I talked about that vaccine, which costs about $50,000. I mean, whatever be the study, can I use that material in my setup? No. So, or can I do a specific robotic surgery in my clinical practice if that robotic surgery is one of the things used in their article? Have they given the methods in such a way that I can actually use it, or they have explained it very broadly so that I cannot use it in my practice? So the second question is, method should answer what was done in such a detail that if I want to repeat this research, I should be able to repeat it with the details given in that particular article. So if the author has given sufficient details, then I will say methods is written well. Then we come to the results. What should the results contain? Again, you can just take a moment to think, what should the results contain?
Finding of the study.
Findings of the study. In very simple terms, results should contain the findings of the study as per the hypothesis or as per the objective. So in the results, findings of the study should be mentioned, but without the author giving his interpretations to those findings. That is very important. It should be unbiased reporting of the findings. And if you want to give an interpretation, you have the discussion section available to you. So author should not be unnecessarily justifying the results. If you see author doing it in the results, then you should take that with a pinch of salt. So it should be result presented as per the objectives. So as very nicely put by our participant, what was found, that should be there in the results. And if you think of what should be there in the discussion, so if you can think of one word of what should be there in a discussion, in a paper.
Interpretation of the findings.
Interpretation of the findings, as we just now mentioned. So what does it mean? So what does it mean to me as a practitioner that this result has come? Or what does this result mean in the context of other research done by others? So that is what discussion should be pointing to us. So for example, we will take this particular article. I hope you have seen this article. We have taken this article by Journal of Dental Research on caries control, caries management strategies. And we can go on about initially about how good the journal is, how good the article is, and things like that. We can ask such questions. For example, is Journal of Dental Research a peer review journal? Is it an index journal? So we can ask this question. And we know that this is available in PubMed, Journal of Dental Research. So it is a peer review journal. How do you know whether it is peer review journal or not? Usually they would declare in the author's guidelines, they would declare what type of journal theirs is. And you can also check, day before yesterday, I talked about how do we search for, in the advanced search, for a specific article or a specific journal. So you will know whether that particular journal is indexed in PubMed or not. So if it is indexed, if it is peer reviewed, then that's a good article to choose. Other thing that you can think about an article is it recent? What is the received date and what is the accepted date? That also will give you some idea about how long the peer review process took place. For example, for this article, April was the received date, and August was the last revision, and accepted in August. So it took about maybe from April to August, it would have taken about a few months for the acceptance. So that also indicates some kind of peer review process there. You should also see whether this is an academic body or a commercially sponsored journal. So that also will make a difference of how much you can believe in this particular results of this particular study. You can also see the type, publisher, impact factor of that journal. So each of these things you can see for seeing the journal quality. Whether the scope of journal is relevant to you, whether it is a national or international, whether it is discipline based or general. For example, this particular article from Journal of Dental Research, I have taken it is not discipline specific journal. It is not specific for pediatric dentistry. So that also sometimes will make a difference. Which type of journal? What is the acceptance rate in that journal? All also will matter. How good is the citation index of that paper? You could also try to find out whether that paper has been cited by many people. So what is the simplest way to find out how many papers has this paper been cited? Anyone can tell me? Because that is from day 4 yesterday. How do you know whether this paper has been cited by others?
Google Scholar.
Google Scholar, definitely. In PubMed also, the other day we saw, once you go to that article, below that article, you have a related articles section and also cited articles. How many articles have cited? So if many articles have cited this article and all of them are from quite reputed journals, you might know this is a good, well cited article. Google Scholar, of course, will tell you specific to author or specific to a journal, how good that journal or author is. Okay, so a lot of times papers are not cited. So such papers may not be so useful. And of course, the impact factor, we all are aware. How many of the articles published in that journal are referred to by other researchers and cited by other researchers? This is called as impact factor. So this is not specific to article. This is specific to that journal. So all the papers together in the journal, how many times they are cited by other journals? That is impact factor. So you can see each of these things and you can judge. But now there is a big movement going on about less emphasis on reputation of journal and more emphasis on the quality of that particular article. So this is a new movement going on now. Don't judge the article by the journal in which it is published. Instead, judge it by its own merit. For example, is a specialty journal better than a general journal? Is an average journal worse than a high impact journal? Is a simple letter to editor worse than an original article? It depends on the context. It depends on what research you are talking about. So don't be fooled by a poor looking journal, but it may have a very good article. Of course, journal quality is important, but that does not mean that all articles will be published in a very good journal. An example I am giving you. 1984, Warren and Marshall published a work in Lancet on H. pylori, Helicobacter pylori. Actually, these people submitted it first to their specialty journal. They rejected it there. Then they thought, okay, why not send it to a very general journal like Lancet? And Lancet wouldn't accept their original article, because it's not a very large scale study. So they just wrote it as a letter to editor. It was a simple letter to editor in a high impact journal. And what follows next is history. Warren and Marshall got a Nobel Prize. And now we have an entire journal related to Helicobacter pylori. So don't go too much by the reputation of the journal, but yes, you should see that as well. And also see by peer review process, why you should have a peer review journal taken for your journal club. Because peer review process is there when an author submits article to the editor, editor will make that decision based on comments and decisions by peer reviewers or referees. So if an article has gone through this at least initial process of accepting, revising, resubmitting or rejecting, at least you can ensure that at least some quality is there. So that is the reason why you should go for the peer review journal. So it will give you unbiased, independent, critical assessment from experts who are not part of editorial staff. And when that process is available, it will help the editor in deciding which manuscript is good for that journal. And probably the article will be good enough for the readers of that particular journal. So that's about the peer review process. I'll not get into the detail. So we will go back to this title now. Caries management strategies for primary molars, 1 year randomized control trial. So they have said results. So is it concise? Is it state what they are comparing? A research question. Does it indicate the study design? Does it represent the study? Is it a misleading title? Is this study relevant to you? So we could think of, just by seeing the title, you can think of answering these questions. So is it concise? Is it misleading? Is it relevant? So you can think of these aspects and you can think of this title. So if we can have some comments on this title, if you have gone through the title, and if you can put it in the chat box. I can go back to the chat box now, and also I invite Dr. Prashant to give his comments on the title. So I'll just stop my presentation as of now.
Yeah.
So if you can go back to that article and see the title and give your comments about, maybe the first comment is this useful to me? Am I using various caries management strategies in my clinical practice? So that is the first question we have to ask. So how does your answer sound for that? Does it look like a useful title? Okay, I'll check in the chat box. Useful title, okay. Which characteristics of the title probably you found are useful? If we can comment on that.
Management
like in what
strategies?
So they summarize caries management strategies. So we know that they are talking about some caries management strategies, and maybe we can go to abstract to clarify what those are. So, and that is relevant to my clinical practice. So probably it is okay for me to read that article. So anything else important because it was caries management strategies, or it is talking about various ways of managing the dental caries. That means it is talking about various treatment methods. So which study design would have been appropriate for comparing various treatment methods?
RCT.
RCT, randomized controlled trial. Anything would have been better than a randomized trial for you to make a decision whether a treatment is good or not. Anything better than a randomized controlled trial would have given you a better idea about the caries management strategies.
What about case control study?
Systematic review.
Okay, we have two answers now: case control study and the systematic review. Case control study is a good design, but that is for whenever we want to know relationship between some exposure and outcome. That would have been very good design. But in this case, the exposure is controlled by the researcher, right? In this case, the exposure is an intervention. So if there is an intervention which can be controlled by the researcher, then it would be better not to do an observational study. Instead, you do a experimental study, especially if the treatment strategies are can be used in day-to-day clinical practice. You can directly do an experimental study. So case control study may not have been a better choice. But what about systematic review? Especially what about meta-analysis? Would that have been a better design? One of the best ways. Why meta-analysis is actually somebody sitting and combining results of other studies. Why should meta-analysis be better than randomized control trial?
Statistical inference of the other studies.
Okay, thank you, ma'am. So what does the meta-analysis do? If you think of it, it takes multiple randomized control trials. Okay, it takes 5, 6, 7, 10, 15, whatever available randomized control trials are there. It picks them up. It combines the results and it gives you a final outcome. Article 1 is telling this management strategy is better. Article 2 is telling management strategy B is better. Article 3 is telling management strategy C is better. But meta-analysis will tell you, combining all the management strategies, which one seems to be better than the other. So meta-analysis definitely would be a better choice for you. If that is not available, then no problem. Then you can go ahead and read a randomized control trial. So that is how we decide about this. Now, what should be there in a title and what should not be? Are there any guidelines? So I just wanted to show that to you. Like if there are any comments from Dr. Prashant, can you like elaborate on anything you want to add here? And
No,
then
I
we
was
can.
no, Ravi. Just I was coming back to again to the title. What should be there in the title? Okay.
Okay.
So I think you're going ahead with that.
Okay. Okay. So nothing to comment on the title. So I'll just show you, like maybe demonstrate, because we wanted to know which guideline should we follow for critically evaluating an article. So yesterday in the literature search, I couldn't show this to you. So today I am just quickly showing you. Let me just share my screen now. Okay. What is there on my screen? I hope everyone can see now. What you can see is Equator network. Can you say I can go back to Google also from there? Okay, I can type Equator network. You can also do it along with me in case you have another system. So I went to this Equator network. So what is this Equator network about? Enhancing the quality of and transparency of health research. So basically this talks about how do we report health research, or how should an author report health research. So if I go over this, you can see reporting guidelines for main study types. Can you see this? Randomized control trials. If the study design is randomized control trial, then the guideline to be followed is consort. If the study is observational study, guideline to be followed is stroke. If the study is a systematic review, guideline to be followed is Prisma. So like if it is a case report, the guideline to be followed is care guidelines. So each study design has a guideline by itself. So if you can go to this guideline and using that guideline, you can evaluate that study, that will be wonderful. So only you need to recognize what study design it is, and then go to that particular guideline. So since we have chosen a randomized control trial, so I will go to consort guideline. I am clicking on that now. You can see this is a consort statement. It has a checklist. It has detailed article published in so many journals. The same article is published in Annals of Internal Medicine, BMC Medicine, BMJ, Journal of Clinical Epidemiology, Lancet. You might say this is duplicate publication. Yes, this is a duplicate publication. This has been published in multiple journals, the same article, because every editor wants to promote this particular guideline. You can see the best of the medicines publishing this, okay, including Lancet, Journal of Clinical Epidemiology, BMJ. Okay, so what is this guideline which everybody is promoting? Let me click on that. So I have the consort checklist. I'm opening the consort checklist now. So this checklist of information to include when reporting a randomized trial. So when the author reports a randomized trial, he should have included each of these things. For example, what should he have written in the title and the abstract? It is there here. He should have identified the title as a randomized controlled trial. In the title itself, he should have mentioned that it is a randomized controlled trial. So has the author mentioned in our particular case, has he mentioned that this is a randomized controlled trial?
Yes.
Yes, they have mentioned. So they have fulfilled this particular criteria of whether the title is as per the guideline. But this is just in surface. What I am showing you is only superficial. But I cannot go into this entire article right now. But what you should know is this is just a checklist. If you go to consort actual article, you will get a description of what all should be there in the title and how a title should be written. So this will also be helpful for you when you're writing your paper later. But this will also be useful. This checklist will be useful for you to evaluate any article that you have want to evaluate. So you can see various aspects are there. For example, introduction, what should be there? It should have, as you already noted, scientific background and explanation of rationale. It should have objectives and hypothesis, as you rightly pointed out. All these 4 points you have pointed out to me when you put it in the chat box. So these points should be there in an introduction. What should be there in the methods of a randomized trial? You can see trial design, eligibility criteria, what interventions were done, and how should the interventions be reported? Even that is there. The interventions for each group with sufficient detail to allow replication. That means if they have described some method, let us say in this article, they have talked about Hall technique. So have they described the Hall technique in at least that much of detail so that I don't have any difficulty in replicating that? Of course, they need not give each and every step. They might give a reference, but they should be very clear about what method they have used. Okay, so some things like that. So there are many things related to methodology that should have been there, like randomization. They should have mentioned how did they generate the random allocation sequence, 0.8a. So we should ask yourself whether this has been done in the article or not, whether they have done the blinding or not, whether they use the appropriate statistical methods or not. So like this, results and discussion also, guidelines are available. So whenever you embark on a journal club or a critical evaluation, make it a point to go to this checklist and select the checklist based on the particular study design. And then you can go back and you can do the journal club evaluation. So let me go back to the presentation now. Okay, so caries management strategies for primary molars, they have mentioned randomized controlled trials. So that one criteria is being followed here. It is concise because they have written caries management strategies. Does it clearly state the variables? They do not state the variables actually, but probably it is mentioned more in the abstract. Does it indicate a study design? Yes. Does it represent the study? If you read the entire study, you know that this is quite well representing the study. Is it a misleading title? No. Only one thing would have been removed from here, results. Because anyway, any article will have results, right? So they could have simply said caries management strategies for primary molars, randomized controlled trial. Okay, so what type of article is this? It's an original article. It is from the clinical section of a journal. And we talked about randomized controlled trial being one of the best designs. On top of that would be systematic reviews for this particular question. So randomized controlled trial quite up in the hierarchy. This is evidence-based hierarchy. Higher up it is, the better it is. That's why somebody when commented case control study, I said, no, not so relevant, because I thought randomized control trial is a better design. Why choose a case control study? Okay, that was the logic. Okay, you also have to see whether these authors are capable of doing that particular study. For example, was this done in a pediatric dentistry department? Because it is on primary molars. Were these pediatric dentists who are doing this study? That also has to be seen. So if all that is there, it looks like it is there. So we don't comment too much about all these things. Whether the methodology being followed was done by the experts or not, that has to be importantly seen. So once you see that, then you see which type of abstract is it. So if we go back to our consort guideline, it has given some components in the abstract also. They say it should be a structured abstract, and abstract should have something about the background. It should have something related to methods, results, and the conclusion. So if you see this abstract which we have got here, initially they talk about the background. They say minimally invasive approaches for managing caries are showing increasing evidence of improved outcome than conventional complete caries removal methods. So at the outset only, they have given the background as to what they are comparing and why they are comparing. In a single sentence, they are telling that there is increasing evidence on these strategies. And then they talk about their methods. They say we present 1 year results. Then they mention which are those 3 techniques which they have compared. They mention it very clearly there: conventional restoration, Hall technique, and non-restorative caries treatment. Then they go to their results. So they have described background, they have described methods. Only here they have not mentioned that it is a randomized trial, because they have anyway mentioned it in the title. But they describe the randomized trial here as parallel randomized clinical trial. They describe in detail what is that trial about. Then they describe the outcomes. What outcomes were measured? That is clinical failure rate as major failure, minor failure. And they also define what they are. And they have also written what was the sample size and what was the main results, like how many failures occurred in which group. So they describe the results, they give their p-values, and they have also given at the end where this particular clinical trial was registered. So clinicaltrial.gov, NCT 0179-7458, you can see at the end. So you can go to this particular clinical trial registry and take out this protocol. And why do you want to take out this protocol? So that you can verify whether the methodology that has been followed is as per the protocol or not. Whether the protocol has been followed as mentioned or protocol has been deviated. So that is one thing which you can use from this particular mentioning here. Okay, does the abstract clarify the title? Title says caries management strategies. Abstract says 3 caries management options. So abstract is nicely clarifying the title. So we can say that's a good point. So these should be there in the abstract when you are critically evaluating. It can be structured or unstructured based on the journal, but you should have all those 4 components: IMRD, introduction, methods, results, and discussion or main conclusion. It should give the gist of the study. It should reflect the contents of that particular article. There should be a coherence from aim to conclusion. And coming to the keywords. So these were the keywords used in this particular article: caries treatment, clinical studies, clinical outcomes, pediatric dentistry, primary teeth, Hall technique. Do the keywords represent the main contents of the article? Looks like yes, though only Hall technique is mentioned. Conventional caries treatment technique is not mentioned, and restorative caries management has not been mentioned here as keyword. So those 2 have been missing, but they have been prominently represented in the abstract. Are there too many? Are there too less? That also you can comment on. You can also comment on whether these are mesh terms. Yesterday I talked about how to search a mesh term. You can go to PubMed and then you can check whether those terms are mesh terms. You can also see what are the indexer specified terms. Again, day before yesterday, I told you about how to open an article and see what are the mesh terms for that particular article. So if you go to this particular abstract, you can open it in Google. And if you scroll below, you have mesh terms mentioned there. So these are the mesh terms of this particular article. So this will give you comprehensive idea of what all was there in this article. For example, they have used crowns. Hall technique used crowns there. So they have mentioned there. This is for children. Basically, preschool children are also there. From age 3, they have selected. So even preschool children are there over there. So that is mentioned here in the keywords. It's about prevention and control of caries. It's about cavity preparation. It's also involving plaque index. It also talks about restoration failure. So you can see that these keywords are quite nicely summing up what all is happening in that article. And now you can see whether the mesh terms specified by the indexer is better than the keyword specified by the author. Author says caries treatment, clinical trial, clinical outcome, pediatric dentistry, primary teeth, Hall technique. So if you compare this to the indexer specified terms, these look definitely better. You can see more comprehensively. Of course, these are too many, but this is talking more comprehensively about what is there in this particular article. Okay, then what should be there in an introduction? You already talked about that to me. Statement of the problem, citation of prior work, statement of lacunae in existing knowledge, compelling argument justifying the need for the study, and a statement of the general purpose or main aim of the study. I am showing an example here. This is a classical article written by Watson and Crick about the double helical structure of the DNA. Classical article when first time DNA was reported to have the double helical structure. You can see how nicely this article is written. For example, we can read out. They cite the prior work in the introduction. A structure for nucleic acid has already been proposed by Pauling and Corey. So they cite a prior work. And you can see how nicely they talk about that work. Their model consists of 3 intertwined chains with phosphates near the fiber axis. And then they identify the lacunae in that. In our opinion, this structure is unsatisfactory for 2 reasons. See, they state the reasons why that structure is unsatisfactory. That particular triple helical structure that was thought about by Pauling and Corey, why that was unsatisfactory. So nicely they have given here explanation. So they have identified the lacunae in the prior work. So you can go back to this particular article now. Read the introduction quickly, maybe a few minutes, like a group work. Instead of a group work, since we are not sitting in groups, you can do it like an activity. Read the introduction and identify some things, and we will come back. So I'm going to keep a timer of maybe about 3 minutes or something, or 4 minutes, and I'll get back. So please read the introduction section of this particular article. If you already read, you can start commenting. Maybe you can start commenting after 2 minutes. I'll wait for 2 minutes now. Oh, till now the screen was not shared? Because I was displaying the presentation.
It was shared.
It was shared.
Okay. I'll open the article for you. there is one question that you will need to answer at the end of reading introduction, and that would be to tell whether you are convinced that this particular research was needed or not. So are you convinced whether this particular research was needed or not? That is the answer that you have to give.
Unmute karo, Prashant.
I'm audible?
Oh, sorry, I was on mute.
Ravi?
Yeah, I think I was on mute. You are audible, Prashant.
I'm audible?
You are audible, yes.
Yes, yes. Okay. So, yeah. Everybody can comment on the introduction, what type of approach it is, whether it's short or long, whether there is a need for the study. So I think we can start with the discussion, Ravi.
Okay. So we already have one comment available to us in the chat box. Dr. Jayashri has mentioned, paradigm shift of caries management has been mentioned with lack of evidences on its effectiveness. The current study gives us idea about effectiveness of 3 strategies of caries management. So, so does this look like the introduction could have improved with some? They do give references about those, I think, management techniques. In what way this could have improved? In what way introduction could have improved? Like if you can specify.
Can anybody think on the originality? Like
I would like to say something. According to me, the study is quite interesting because it tells us about it. It basically stresses upon the different treatment modalities for management of caries, and all the 3 different techniques. Like one is the conventional technique where you excavate the caries and restore. The second is the halt technique. And third one where you're just excavating the caries and allowing fluoride application or the parent to brush. They are 3 totally different techniques. So it is a very good concept, in my opinion, based on only the introduction.
Okay. So would that be applicable? Like, are you convinced about comparing these 3 techniques, ma'am?
Yes.
Okay. On a scale of 0 to 5, where would you rate the introduction? 5 being very good.
4.
4. Okay. So any other comments on introduction? Was the actually already commented by one of the participants. Even I had some similar comment. They said, you know, if we go to the introduction, maybe I'll share my screen. I'll tell you what are my comments on introduction. Okay, if we go to that introduction, some things which I noted. They have cited the prior work. Like they say, conventional surgical approaches being challenged by more biological, less invasive approaches, where emphasis to arrest the carious lesion. So they cite the prior work there, you can see. Then they again continue citing the prior work for each of the technique, Hall technique, partial, stepwise, and fissure sealing. They do cite the prior work. They do give the statement of problem that the other caries management techniques have now been subject of ongoing debate. And then they say there is limited evidence for one technique over the other technique, like limited comparative evidence for one approach over the other. That leaves the clinicians uncertain. And they convince us saying that this uncertainty of clinicians as to how to choose one technique over the other because lack of studies are there. So we want to do this study. That's what they say. So again, they state their problem quite well. But only one question which came to my mind. Is this a compelling argument justifying the need for the study? Just because there is a vigorous debate, does that mean we should take up that study? Or shouldn't you talk about which are those aspects in that vigorous debate about why the other methods are also useful, in what way other methods are useful, or in what way other methods are chosen, or why the conventional method has been challenged? So instead of saying it has been challenged, if you say why it has been challenged, probably that could have been a better introduction. So that's what I feel. So are there any more comments on introduction?
Okay, Ravi, I'll tell my views.
Okay, I'll just stop the sharing. Okay.
Yeah. So introduction, I think there should be a little more originality in the introduction because the referencing is more in the introduction. Maybe and definitely they were discussed about the hypothesis and all, but the techniques what they mentioned is fine. But only thing is there any newer technique in this? Would have discussed. So maybe the conventional Hall's technique and the one more technique.
Non-restorative caries management.
Yeah, non-restorative. So what is the useful, like in this, maybe more general to specific, they would have come to want to discuss, like maybe more specific they would have mentioned in this. And maybe they have the I think introduction is too short. Okay, maybe another one or two para they would have included.
Okay, thank you, Prashant, for those comments. So, so we can go back to our consort checklist actually, and see what all should be there in an introduction, so that we can clarify a little more about what we commented, what we both commented. Probably you will learn more if you go back to consort checklist. So I'll just share that checklist now, and let us see what should be there in an introduction. So scientific background and explanation of rationale. So I think we both felt probably explanation of rationale, scientific background is well written. That means they have given references quite well. They said there is a challenge, but explanation of rationale as to why this has been challenged, why conventional method has been challenged, could have been elaborated in the introduction. And did they write their hypothesis? Yes, they do give their hypothesis very clearly in their introduction. So that particular objective has been met. So we will go back to the presentation now. We will see now little bit of methods.
Ravi.
Yes, Prashant.
Yeah, before going to the methods, and methods, can you tell something about the approaches for writing introduction?
Okay. Maybe I'll talk about the more general to specific approach, what has already been mentioned earlier.
Yeah.
So usually an introduction should first introduce the reader to that particular topic in general, especially something about what is the prevalence of that particular problem. For example, they talk about caries management strategies in primary molars. How prevalent is the caries in primary molars? If that has been mentioned, that will give a background, nice background as to how important is this problem clinically. Or they could even mention saying that on an average, a pediatric dentist treats these many carious lesions for primary molars compared to other treatments that he does. So, or on an average, what is the number of children who have caries in the primary molars? So, if that kind of background information is being given, though readers are well aware about the problem, clinical problem, they may not be well aware about the epidemiology of that particular problem. So, if that can be mentioned in general, and then you can move specifically to these three techniques, each of these techniques, and say how conventional technique is used and what are the disadvantages, especially, or what is the lacunae in the conventional method, and then describe a little bit regarding Hall and the non-restorative caries management techniques as to how they came into picture. So if a little bit background could have been given from general to specific, it would have been better. That's what I felt.
Yeah, thank you, Ravi. You mean to say from general to specific, or some burden of the disease or problem-based type of approach?
Yes,
or
yes.
we can have a seminar type of approach.
Seminaristic approach, yeah.
Yeah. Thank you, Ravi.
Yes. Okay. Oh, sorry. Okay, I am coming to the methods now. Okay, what all should be there in the methods? So I already asked this question to ma'am, so I'm asking each one of you now. On a scale of 1 to 5, after seeing your consort checklist, where do you rate this introduction? You can think of a number for yourself. You can put it. So once we finish all the 4 sections, maybe we can rate it together. How well was this? So you can just note down how much marks do you give for this introduction on a scale of 1 to 5, 5 being the best and 1 being the worst. So if you score 4 or less, you should also be able to say what author should have modified. Okay. So that is one more responsibility. Okay. Screen is shared and visible, right? Okay. So I'll move ahead now to methods. Okay. So method should identify first the research design and explain why this particular design was chosen. So you do not just say in the methods as to, this was my design, but you should also be able to justify, author should be able to justify why they chose that particular design to address that research question. So if they can do that, it's well and good. They should describe the target population of interest, especially, what was the age group, gender, which clinical setting was this done? All that. But what is the target population? What is if the results of this study are good, to which groups can I apply the results of this study? So describe the target population of interest and their characteristics. They should clearly state the inclusion and exclusion criteria. And you should comment whether this inclusion criteria was good enough or not. Did they exclude some important group, or was their inclusion criteria too rigid? So you can comment on that as well. Because ultimately, the results of your study will be applicable to only the group which is included. Let us say they excluded people of more than 7 years age. Then the results of that study or their conclusions cannot be applied to any child who is over 7 years of age. So if they have done some unnecessary exclusions, then we should be able to comment on that. I have a very nice example here on metformin. You can see this is a protocol. You can see in this protocol of a metformin study, you see how nicely I wanted to show the inclusion exclusion criteria only there. You can see how nicely the eligibility criteria has been mentioned. You can see inclusion criteria, so beautifully mentioned. Exclusion criteria, so very specific. So whenever a study mentions inclusion exclusion criteria to such a detailed extent, then it is a very good aspect of that particular study, because then you can decide whether you can generalize that particular study or not. They should mention how the sample size was estimated and how was the sample size determined. I think in this study they have done it, but you should also comment on whether it was adequate or not. You should identify the settings where the data was collected. So how the patients are referred to here, which type of setup is it? Is it a primary care center, tertiary care center, where it was done? If the patients were assigned to groups, randomized, then they should have mentioned what method of random allocation was used, lottery method, block randomization, what method was used. They should tell how and when the patients were assigned to groups. Like, how was the case defined? How was the outcome measured? They should describe the exposure or intervention or therapy that was done, like clear description of drugs used, proprietary names, if there are any, like for example, they have used a crown. Have they given the proprietary name or manufacturer details of the crown used? Have they given details of devices that were used? Have they identified any sources of bias? This all should be there in the methods. Like, are there any biases that can have happened in this study? They should mention calibration details. For example, whether the data was reliable. We call it as reliability statistics or kappa statistics. They should mention that in the study. Is the examiner measuring carries? For example, in this case, they have measured carries. How well they have measured carries? Are there any measurement errors in doing the carries measurement? And is it have they done any duplicate measurements? That means, have they repeated some measurements to confirm the quality of their measurements? So this also is a good aspect of a method. Method should also say whether ethical approval is taken, whether the design is appropriate, sample size is adequate, whether the study subjects are included with the reasonable criteria, bias and blinding. For example, in this study, they have mentioned about ethical aspects. They say ethical approval was taken. So since ethics related discussion has already been done to you, so I want to ask you, for this particular study, are there any aspects related to ethics that you can think of? You can think of and put it in the chat box. Are there any aspects related to ethics that you can think of? I'm stopping my screen sharing now. So you have read this study. Are there any ethical aspects which has not been addressed? They have said they have taken consent. They have said they have taken ethics committee approval. But what are your concerns for this study? So I have opened the chat box now. Please put it in the chat box. little uncertainty regarding its applicability in etiology of caries. Is every participant benefited? The second point I'll take, is every participant benefited? So that is definitely an ethical question. Or are there any adverse effects in some participants compared to some other participants? And did they have any rules to stop the study if the more adverse events were occurring in one group compared to another group? So this is the question we have to ask, whether one group was having more adverse outcomes compared to another. So any other comments regarding ethical aspects?
The one should receive the highest level of treatment, the best treatment.
Okay, one should receive the best available treatment. So in this study, has everyone got the best available treatment? So any comments on that? We are looking at the chat box. Myself and Prashant will be looking at the chat box and we will respond to your comments. I know pediatric dentists would be there here. I'm sure you will have some ethical concerns. Please, you could put it up in the chat box, or you can directly unmute and speak. What would be your ethical concerns?
Regarding the leaving behind of the caries and allowing the parent to brush the tooth. I mean, how clinically successful would that be? Because we don't really practice it, leaving behind the caries as it is.
Okay, so a very valid point now mentioned by ma'am. Can we do this in our setting? Can we allow a tooth to be not restored? That's what Dr. Prashant was commenting when he said, is this the best possible treatment available? So yes, as pointed out by ma'am, can we just leave out the caries open like that? Especially if there are sensitivities and if the food gets accumulated there and chances of increasing depth of carious lesion is higher, that we all know by common sense. So then should they have left it or not? So definitely that is an ethical question. They have taken ethics committee approval. Probably they felt in their population that is good enough. But this is what we need to ask when we find such a study. So any other ethical aspects, age of the patients, consent, assent. So anything about that in our previous discussion on ethics? Should the assent have been taken from the students, children? So all those aspects are there. Should the adverse events have been reported? Should they have managed the caries? If the caries occurred, if the complication occurred, how did they manage the complications? So probably that all should have been. So, that all should have been mentioned, I felt. So I'll move ahead since we are having less time. I'll move ahead to other aspects of the methodology. So is it appropriate to do the other two methods other than conventional method? That was the question which Dr. Prashant also asked. Should assent have been taken? How are the adverse events or major failures addressed? So these are all ethical aspects. Like if you go to ICMR, we have a ethical guideline for human research participants. And when can a study be done in children? Children is a specific group. Children are a very specific group. So can we do a study on children? Could this study have been done in adults first and then on children? So all those questions will arise. So Then the next question, is this study design appropriate? I think we have addressed this question already. Is this study design appropriate? What is the design? Study design, it is a solution that fits the need and planned and executed well. So what was the need for this particular study? Whether this study took that research design or not. That is a question we need to ask. Research question here is about therapy. So study design taken is randomized controlled trial. So probably we would agree that this is a adequate design. So our introduction should lead us to that particular design actually. And methods to justify that design. So that is how a good design is. So a good study design should be a plan that should match the purpose. There are many options for taking a study design. Every design has advantage, disadvantage. So just because they have not taken an RCT does not mean you should not read that paper. But basically, you should read that in the context of that particular objective. And we have key features and guidelines available for each design. For example, we have for randomized control trial like consort design. So we should go to that. So when research question is about therapy, RCT is gold standard. We have already seen that. So they have taken that design. In the methodology, they should have mentioned the sample size estimation. I think they have mentioned it. They have mentioned how they have calculated the sample size. They have justified it. They have some criteria given there. So do you agree with that criteria? So some comments on that. I'll not go to each and inclusion exclusion criteria because it will be beyond the time limit that we have. So if you go to the criteria for that particular, this one thing which I'm showing from table 1, we have outcome criteria for the 3 assessment of success. So do you agree with this criteria? Just go through this criteria, take a minute or two, and each technique was deemed as successful or failure based on these 3 criteria. And criteria was different for each technique. So do you agree with this criteria? Shall we, or we have some comments? So you can.
Criteria seems fine.
Okay. So, in what way you think it is fine? Like, I mean, is there anything to comment on that?
Actually, I went through it very quickly.
Okay. 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 Any other comments on criteria?
Can you enlarge the screen, please? Yeah, this is better.
Okay.
Can we have one single criteria for all these 3 outcomes or different techniques? Can we think in that manner?
Or to add to Prashant's question, should we have same criteria for evaluating all the 3 groups, or can we have different criteria for evaluating all the 3 groups? See, in the non-restorative caries management, they have not talked about whether the restoration is there or not there because they have not placed the restoration only. Whereas in conventional restoration method, if the restoration is placed and missing, it is deemed as a failure.
Failure.
Whereas in non-conventional method, restoration is not placed only. So, so how can you say that just because restoration is missing, that is a failure?
Failure.
Right.
So, if you go through that actually table, you might probably come across many questions related to their inclusion or their assessment criteria for each of these groups. So as Dr. Prashant commented, can we have a uniform criteria for all the 3 groups?
Feedback.
So that is a very important component of a research. But in this case, can we justify having 3 different criteria for each of the groups? You should be able to justify and decide for yourself. There is no one right answer. Decide for yourself whether these criteria were good enough or not. Then have they done blinding? Because this is a randomized trial. This is one of the things supposed to be done. Blinding. Did they do the blinding? Did they do the reliability statistics? So we will go back to the methods very quickly. I display. I'll maybe identify one or two aspects related to that. So how about blinding? Was the blinding done? Is it important to do the blinding in this particular study?
Whether blinding can be done or not.
Yes, whether blinding can be done or not. Please comment in the chat box.
Blind.
Ma'am, you are not audible.
Yes.
I think ma'am is trying to comment. She's not audible.
Unmute करो.
KB, unmute yourself.
Yeah. Anybody have any questions?
Yeah, Prachin madam, please comment.
Yes, sir.
Yeah, you are commenting something. You can please comment.
I mean, what would be the advantage of blinding in this study? Because the techniques are 3 different techniques completely. So I don't see any advantage of blinding in this study. I'm sorry.
So who could have been blinded? Okay, so if we think of blinding, we can blind the person who is doing the treatment, which is not possible in this case because you have to do that treatment. So you cannot be blinded to do that treatment. But can the person who is assessing the effectiveness of that outcome, especially the criteria, outcome criteria, could they have been blinded?
Yeah, they could have been blinded. But then,
no, is it possible to blind the outcome? Because Hall's technique is like placing a crown, and one is restoration, the other one is non-restorative caries treatment. Can even evaluator can be blinded?
I mean, I honestly, I don't feel blinding would have been of any.
Okay. We agree with you, ma'am. We are agreeing with you on that. Actually, we wanted that point to come up because it can, as Prashant, Dr. Prashant can comment whether blinding could have been done. Dr. Prashant can comment.
Yeah, so it is very difficult in here to blind the partner, blind the evaluator or to blind the dentist who are doing the exactly treatment. But the invariably we can blind the third person, the statistician.
Okay, right.
So levels of blinding, if you go through those, consort checklist does have the mention about the levels of blinding and who is blinded, and so if you go through that, probably you will be able to comment better on this. So not everyone can be blinded all the time. So don't comment on a study just because blinding is not done. This is not a good study. So that is what is the point which we wanted to bring up here. So there are a few more aspects. Maybe we will take another 10 minutes, sir.
No problem, Ravi. In chat box, there are so many queries, I feel. Please go through that once.
Okay. I think already.
Yeah, all the chats are.
All the chats have been addressed already.
Addressed, yeah.
Everything is addressed. Okay.
If you have anybody, if you have any questions now, they can once again put in the chat box.
Maybe while doing this internal validity assessment, is there some guidelines for us? This much of percentage means has to be minimally have the internal validity points to tell ourselves, okay, this article is internally validated, so these findings can be generalized. What are minimum major criteria which we should look in internal validity, and what we can little bit we can ignore or we can accept, well, particularly with respect to internal validity.
Okay. So whether internal validity can be quantified, and is there any minimal limit for an internally valid paper? So if we see the people who usually do a lot of critical evaluation are the people who do meta-analysis. So if we go to Cochrane collaboration and if we see their method of meta-analysis, they do have scales like there is a Jadard scale for methodology. Even in Cochrane collaboration, they have a grade scale for methodology. But a lot of times, though we give weightage to aspects of study design, ultimately it is qualitative.
Okay.
Ultimately, we have to decide whether this made a significant impact on the results or not. So that judgment would still be qualitative.
The judgment will be from the person who is doing the evaluation. So it's left to is a qualitative aspect of looking into the article, what he is looking, then accordingly on his assumption, subjective assessment as well as objective assessment considering, he will decide whether this article has enough internal validity so that I can use it to generalizability. Is it something?
Yes.
Shall I comment? Yeah.
Yes, please.
So whenever we do this meta-analysis, so we have for every design, like if it is randomized control, there is a 1 point. And if there is a satisfactory sampling technique, again, there is a point. Okay. So whether it is blinded or not, again, there is a point. So
like this, how many points we should look forward, minimum, so that, okay, but this article is, I can accept with confidence that this is internally validated. So I can use how many points I should look forward to this minimum?
Maybe when we put up like a forest plot. So but that requires many studies, but for a single study, it becomes very difficult.
We cannot quantify for a single study, but meta-analysis, we can do some statistically to find out whether these articles which we are considering
as this technique, if you are working for the particular technique, okay, so many randomized controls tied together, we can put a forest plot, then we can judge whether this can be like applied for our in the clinical practice.
As Dr. Ravi, I hope you are telling something about subjective qualitative assessment. It implies for both for single article as well as for meta-analysis also.
Actually, we do have a scale. As I mentioned, there are 2 scales, grade scale and Jadard scale, and there are many other scales available for quantifying the internal validity of an article. But after quantifying also, instead of saying this is the minimum number and beyond this number we shouldn't accept it, I think we should see how many articles are there on that particular topic in general, and what is the best evidence available. So ultimately we will pick up the best evidence available for a set of articles, and for each article, like though we quantify, ultimately we need to see few research which is replicated. If research has replicated the same results, then obviously the value of that particular result will go up, even though individual studies may not be of top quality. Still, we will still get a gross idea of whether this treatment is effective or not, if multiple studies are proving the same thing. So I don't go by too much by quantitative evaluation of each article.
It's qualitative. Okay.
That's why there is always scope of new techniques to come up.
Yeah. So it understand the meaning of research. Again, search.
Further studies needs to be conducted.
Any other questions from any participant? Dr. Ravi, Dr. Prashant, thank you very much. It was nice having you people both here. And sharing your expertise. Dr. Ravi, it was really wonderful. The session went well. People were involved and they were benefited, particularly postgraduate students. Hopefully, this will be carried forward in their post-graduation activities. And again, Prashant, again, Dr. Ravi, I express my heartfelt thanks for contributing to our workshop. Again, in future, if it is required, we will approach you people. Please support and participate in our near future activities. Thank you one and all. On behalf of Shodha and team, Deviation, I express my sincere, heartfelt thank you, Dr. Ravi, Dr. Prashant. Thank you.
Yes, I just want to comment one thing.
Yeah, please.
We couldn't go in detail into many
Yeah,
other
yeah,
aspects of.
yeah, I understand because it's very beginning. Again, we'll come back with this probably meta-analysis and other activities when we club. Probably in this orientation to PGs and all, we can have expanded sessions for particular these things. I think we discussed regularly, Sigli Madam and all, we are already discussing to have these type of sessions in near future. After let these students get acquainted little bit, probably then it's a fundamental basic. In future, we will take these type of sessions.
So maybe it can be taken for a whole day program, critical evaluation.
Yeah.
So thank you, KB. It was very honor to work with you, and you have called us for speaking. I mean, for participating. Thank you very much, KB.
Thank you, Ravi sir.
Thank you, Ravi.